ನಾವೆಲ್ಲರೂ ಸಹ ನಮ್ಮ ಕಾರ್ಯಕ್ಷೇತ್ರದಲ್ಲಿ ಬೆಸ್ಟ್ ಆಗಿ ಮಾಡಿದ್ರೆ ಇಟ್ ವಿಲ್ ಬಿ ಸೋ ಗುಡ್. ವಿ ಕ್ಯಾನ್ ಇನ್ಸ್ಪೈರ್ ಅದರ್ಸ್. Well, friends, I wish to specially ask you, friends, look at attitude. It can be a threat or an obstacle. Lack of continuous monitoring and surprise inspection by the regulators also is a threat or an obstacle. That means we should make surprise inspections, continuous monitoring. I want to ask each and every one of you. All of you have been trained. At some point of time, we have had biomedical waste management training, infection control training, and we are doing it. In the next 2 hours, we have rich, experienced resource persons. Dr. Ramakrishna Gaud, we have Dr. Akshay, we have Dr. Narasimha, we have Mr. Manoj. In next 2 hours, let us get trained more. And let us request Empri to send the slides. Let us repeat the trainings in our primary health centers, community health centers, district hospitals, veterinary hospitals, sub-centers. Train others, our own colleagues and staff. ನೋಡಿ, ಬೆಳಗ್ಗೆ ಎದ್ದ ತಕ್ಷಣ ನಾವೇನ್ ಮಾಡ್ತೀವಿ? ದೇವ್ರಿಗೆ ನಮಸ್ಕಾರ ಮಾಡ್ತೀವಿ. ದೇವ್ರಿಗೆ ನಮಸ್ಕಾರ ಮಾಡಕ್ ಮುಂಚೆ ಯಾವ್ದಾದ್ರು ಪುಸ್ತಕ ನೋಡ್ಬಿಟ್ಟು ದೇವ್ರಿಗೆ ನಮಸ್ಕಾರ ಮಾಡ್ಬೇಕು ಅಂತ ಮಾಡ್ತೀವಾ? ಇಲ್ಲ. ನಮ್ಮ ಅಪ್ಪ ಅಮ್ಮ ಅದನ್ನ ಕಲ್ಸ್ಬಿಟ್ಟಿದ್ದಾರೆ, ನಮ್ಮ ಸಂಸ್ಕೃತಿ ಅದೇ ರೀತಿ. I would request each and every one of you here to consider, can we do biomedical waste and infection control management, biomedical waste management, infection prevention and control? Can we do it as a culture? ಒಂದು ಸಂಸ್ಕೃತಿ ತರ ಇದು ಬೆಳೆಸೋಣ್ವೆ. ಯಾಕೆ ಇದಕ್ಕೆ ಹೇಳ್ತೀನಪ್ಪ ಅಂದ್ರೆ, ಗುಲ್ಬರ್ಗನ ಸಾಕಷ್ಟು ನಿಮ್ಮ ಎಲ್ಲ ಸೆಂಟರ್ಸ್ಗೂ ಸುಮಾರು ಕಡೆ ಬಂದಿದ್ದೀನಿ ನಾನು. ಜಿಲ್ಲಾ ಕಚೇರಿಗೆ, ಜಿಲ್ಲಾ ಆಸ್ಪತ್ರೆಗೆ, ಎಸ್ಪೆಷಲಿ ಚಿಂಚೋಳಿ, ಆಳಂದ್ಗೆ ಲಕ್ಷ ಇನಿಷಿಯೇಟಿವ್ಗೆ ಮೆಂಟರಿಂಗ್ ಬಂದಿದ್ದೀನಿ ನಾನಲ್ಲಿ. ನಾ ಕೇಳೋದೇನಪ್ಪ ಅಂದ್ರೆ, can we make Gulbarga district best in biomedical waste management, best in infection control? ಕೋವಿಡ್ ಇತ್ಲ ಕಡೆ ತಲೆನೇ ಹಾಕ್ಬಾರ್ದು, ಅಥವಾ ಕೋವಿಡ್ ರೀತಿಯ ಬೇರೆ ಇನ್ಫೆಕ್ಷನ್ಸ್ ಬಂದಾಗ ನಾವು ಚಾಲೆಂಜ್ ಆಗಿ ಮ್ಯಾನೇಜ್ ಮಾಡೋ ಹಂಗ ಆಗ್ಬೇಕು. Can we develop Gulbarga district the best in Karnataka? God willing, best in India. Please think over. Keeping all this in mind, objectives of this workshop is introspect, review current scenario, and strengthen strategies to manage biomedical waste and infection control better, both within and outside the healthcare setting. Still it reaches Brindavan enterprise. Meet stipulation of the BMW rules 2016 and 2018 amendments and recommendations of the National Green Tribunal. Recall and list precautions needed in the context of COVID pandemic and such other disasters. My friends, I repeat, introspect, review current scenario, and strengthen strategies to manage biomedical waste and infection control better, both within and outside the healthcare settings. Meet stipulation of the BMW rules 2016 and 2018 amendment and recommendations of the National Green Tribunal. See, this is our duty. Why someone else should come and tell that you are not doing well? Recall and list precautions needed in the context of COVID-19 pandemic and such other disasters. Friends, ಅರಿಸ್ಟಾಟಲ್ ಅಂತ ಒಬ್ಬ ವೇದಾಂತಿ, ಅವನು ಹೇಳ್ತಾನೆ, ನಾವು ಒಳ್ಳೆ ಕೆಲಸನೇ ರಿಪೀಟೆಡ್ ಆಗಿ ಮಾಡ್ತಾ ಹೋದ್ರೆ ವಿ ರೀಚ್ ಎಕ್ಸಲೆನ್ಸ್ ಅಂತೆ. ವಿ ಬಿಹೋಲ್ಡ್ ವಾಟ್ ವಿ ಆರ್. ವಾಟ್ ವಿ ಆರ್, ವಿ ಬಿಹೋಲ್ಡ್. ವಿ ಆರ್ ವಾಟ್ ವಿ ರಿಪೀಟೆಡ್ಲಿ ಡೂ. ಎಕ್ಸಲೆನ್ಸ್ ಈಸ್ ನಾಟ್ ಅನ್ ಆಕ್ಟ್ ಬಟ್ ಎ ಹ್ಯಾಬಿಟ್, ಬಟ್ ಎ ಕಲ್ಚರ್. ಸ್ನೇಹಿತರೆ, ಗುಲ್ಬರ್ಗಾ ಡಿಸ್ಟ್ರಿಕ್ಟ್ ನ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಲ್ಲಿ, ಇನ್ಫೆಕ್ಷನ್ ಕಂಟ್ರೋಲ್ ಅಲ್ಲಿ ಬೆಸ್ಟ್ ಮಾಡೋಣ ಇಡೀ ಕರ್ನಾಟಕಕ್ಕೇನೆ. ನಾವೆಲ್ಲರೂ ಪ್ರಥಮವಾಗಿ ನಮ್ ಕೆಲ್ಸಗಳನ್ನ ಪರ್ಫೆಕ್ಟ್ ಆಗಿ ಮಾಡಿ ಉಳಿದವ್ರನ್ನ ಇನ್ಸ್ಪೈರ್ ಮಾಡೋಣ. ನಮ್ ಕೊಲೀಗ್ಸ್ನೆಲ್ಲ ಲೆಟ್ ಅಸ್ ಟ್ರೈನ್ ದೆಮ್ ಬೆಟರ್. ವಿತ್ ದಿಸ್ I would like to tell you that I wish to come to Gulbarga district after 6 months. You must tell me it is the best in Karnataka. It's going to be the best in India. Thank you very much. Thanks very much to Dr. Mahesh, Empri, all our resource persons, and each one of you from Gulbarga district. You are going to be the champions. I want all of you to be the champions of biomedical waste and infection control so that we can protect ourselves first. Thank you very much, friends. Ramakrishna Gowda Mundu.
Thank you, sir. Thank you, sir. Thank you, Prithvish, sir, for giving this training program
Thank you, sir.
an energetic kickstart and a very motivation talk. Now, I would like to invite our another resource person, Dr. Ramakrishna Gaud, sir, to talk on Biomedical Waste Rules 2016 and an overview of it. Over to you, sir.
Thank you, Pooja. Thank you. Pooja, I'm sharing my presentation.
Yes, sir.
One nimisha, just give me a time. Seconds time. Pooja, just give me a second, ma, and it is
Okay,
taking
sir.
a little while. The presentation is there. One minute. Is it seen?
Yes, sir. Yes, sir.
Okay. So thanks, Pooja, sir. Thanks, Prithvi sir and my sir once again for starting the day's deliberation. So ನನಗೆ ಕೊಟ್ಟಿದ್ದಂತ ಮ್ಯಾಂಡೇಟ್ ಈ ಸೆಷನ್ ಅಲ್ಲಿ ಟು ಗಿವ್ ಆಲ್ ದ ಕಲಬುರ್ಗಿ ಹೆಲ್ತ್ ಕೇರ್ ಸ್ಟಾಫ್ ಬೋತ್ ಫ್ರಮ್ ದ ಮೆಡಿಕಲ್ ಆಸ್ ವೆಲ್ ಆಸ್ ಅವರ್ ಕಲೀಗ್ಸ್ ಫ್ರಮ್ ದ ವೆಟರ್ನರಿ ಅಂಡ್ ಆಲ್ಸೋ ಫ್ರಮ್ ದ ಆಯುಷ್ ಸ್ಟ್ರೀಮ್ ಟು ಗಿವ್ ಮೈ ಮ್ಯಾಂಡೇಟ್ ಈಸ್ ಟು ಗಿವ್ an overview of the biomedical waste rules. So rules ಅಲ್ಲಿ ಸಾಕಷ್ಟು ಶೆಡ್ಯೂಲ್ಸ್ ಸೆಕ್ಷನ್ಸ್ ಸಬ್ಸೆಕ್ಷನ್ಸ್ ಇದೆ, ಪೆನಾಲ್ಟಿ ಪ್ರಾವಿಷನ್ ಡೀಟೇಲ್ಸು ಇದೆ ಆಸ್ ಪರ್ ದ ಎನ್ವಿರಾನ್ಮೆಂಟ್ ಪ್ರೊಟೆಕ್ಷನ್ ಆಕ್ಟ್ 1986. ಬಟ್ ಫ್ರೆಂಡ್ಸ್, ನಾನು ಇದನ್ನ ಒಂದು ಲಾ ಸೆಷನ್ ಮಾಡಕ್ಕೆ ಇಷ್ಟಪಡೋದಿಲ್ಲ. ವಾಟ್ ವಿ ಹ್ಯಾವ್ ಅಟೆಂಪ್ಟೆಡ್ ಹಿಯರ್ ಈಸ್ ಟು ಹೆಲ್ಪ್ ಯು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ದ ಪ್ರಾವಿಷನ್ಸ್ ಆಫ್ ದ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ರೂಲ್ಸ್. ಆ ಪ್ರಾವಿಷನ್ಸ್ ನ ಅರ್ಥ ಮಾಡ್ಕೊಂಡು ಆ ಪ್ರಾವಿಷನ್ಸ್ ತಕ್ಕಂಗೆ ನೀವು ನಿಮ್ಮ ಆಸ್ಪತ್ರೆಗಳಲ್ಲಿ, ಹೆಲ್ತ್ ಕೇರ್ ಸೆಂಟರ್ಸ್ ಅಲ್ಲಿ, ಹೆಲ್ತ್ ಕೇರ್ ಫೆಸಿಲಿಟೀಸ್ ಅಲ್ಲಿ, ವೆದರ್ ಬಿಗ್ ಸ್ಮಾಲ್, right from a primary health unit to a primary health center, both in the medical as well as in the veterinary stream, up till a tertiary care hospital. ನಾನು ನಿಮ್ಗೆಲ್ಲಾನು ಟೇಕ್ ಹೋಮ್ ಮೆಸೇಜಸ್ ಕೊಡ್ತೀನಿ, all of them which are synthesized from the rules. So that will be how that's how I have planned this session. So ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಗೊತ್ತು biomedical waste rules have been in place for the last almost since the year 1997-98, and it has undergone a lot of amendments, and right now the latest rules we have is the biomedical waste management rules 2016. ಅದಕ್ಕೂ ಕೂಡ ಸ್ವಲ್ಪ ಅಲ್ಲಲ್ಲೇ over the last 3-4 years ಸ್ವಲ್ಪ amendments ಆಗಿದೆ, including the latest being some guidelines very specific to COVID-19 waste management, which Dr. Prithvish had mentioned. A special focus has been given to COVID-19 waste management in the rules. And other bagge, my colleagues, Dr. Akshaya and Narsimha, are going to give you the details of it. So please do not worry. So ಈ session objectives, friends, ನಾನು ಹೇಳಿರುವಂಗೆ to give you an overview of what biomedical waste management is all about as per the rules. What is that we have in it, which we can use for implementing the systems at our facilities. Now, biomedical waste to healthcare waste, the difference, Sumar kade kelirtiri. When we say biomedical waste, it's a very overarching umbrella term which covers all of the waste that gets generated in the Ayush or Indian systems of medicine stream, the veterinary stream, and also the biomedical and also the medical stream, including the dental care facilities. ಇದೆಲ್ಲರೂ ಕೂಡ ಕಂಬೈನ್ಡ್ ಆಗಿ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಅಂತೀವಿ. ಹೆಲ್ತ್ ಕೇರ್ ವೇಸ್ಟ್ ಅಂದಾಗ ಇಟ್ ಜಸ್ಟ್ ನ್ಯಾರೋಸ್ ಡೌನ್ ದ ಸ್ಕೋಪ್ ಟು typical medical centers. So my urging to all of you will be to always have a discussion and deliberations on whenever we talk about ದೈಹಿಕ ಜೈವಿಕ ಆರೋಗ್ಯ ತ್ಯಾಜ್ಯ ವಸ್ತುಗಳ ಬಗ್ಗೆ ನಾವು ಮಾತಾಡಿದಾಗ ಪ್ಲೀಸ್ ಕೀಪ್ ದ ಕಾನ್ವರ್ಸೇಷನ್ ಟು ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಬಿಕಾಸ್ ಇಟ್ ಕವರ್ಸ್ ಎವ್ರಿಥಿಂಗ್. And quite rightly so, even our rules are called as biomedical waste management rules. So these rules apply to all the streams, just like I mentioned. I will talk a little bit of this thing in my subsequent slide also. And this, friends, I am little, every time I elaborate on this. Now, biomedical waste management ಬಗ್ಗೆ ಮಾತಾಡಿದಾಗ ಸುಮಾರು ಸಲ ನಾವು ಡಿಸ್ಪೋಸಲ್ ಅಂತೀವಿ. No, disposal is one minor step in waste management. Biomedical waste management is everything about all of us who are generating the waste while taking care of the health of the human beings, animals, and also while conducting research. We understanding the waste items that we generate. ಏನಪ್ಪ ಈ ತ್ಯಾಜ್ಯ ವಸ್ತು ನಾನು ಜನರೇಟ್ ಮಾಡಿರೋದು. ಲಾಸ್ಟ್ ಸೆಷನ್ ಅಲ್ಲಿ ನಮಗೆ ವ್ಯಾಕ್ಯೂಟೈನರ್ ಬಗ್ಗೆ 1 or 2 questions ಇದ್ವು. ಅದಕ್ಕಿಂತ ಮುಂಚೆ some of our doctors have asked, sir, how do we have to manage copper tea? These are all very good questions. That means you are thinking about the waste item, the item that you are generating. So that is the first step. Only when you understand this, then the other aspects will come, such as segregation, containment, the disinfection, again, transport of the waste within the hospital, temporary storage, and finally handing over to the common biomedical waste treatment facility. So all of these things constitutes management. Disposal is one final step, which our common treatment facility friends take care of. Be it plastics being say after getting shredded, being sent to plastic waste recyclers agirli ಅಥವಾ incineration ash na ನಾವು identified landfill ಅಲ್ಲಿ in the hazardous waste treatment facility landfill ಅಲ್ಲಿ ಆಗಿ ಅಲ್ಲಿ safe ಆಗಿ ಡೆಪಾಸಿಟ್ ಮಾಡೋದೇ ಇರಲಿ. These are the final end to it, which according to us is very minor. What is most important thing is the first few things I said. So whenever we talk about waste and doing something about it, we always have to talk in terms of management. Please, this is my humble urging to all of you. Now, biomedical waste, the definition. It is the waste that we generate while taking care of the health of the human beings, the animals. Our dental colleagues take care of the health of the human beings there. The waste that they generate also comes under the biomedical waste, and also the waste that we generate in our clinical research organizations, laboratories, animal houses. All of this thing is considered as biomedical waste, including, friends, the waste that we generate while doing immunization camps, and also the testing. Sumar COVID al sumar testing madidvi navellallu nook and corners of the cities and towns we have done testing, so generating that swabs and other things. So all of that also is the waste that we generate doing these camps also is covered under the purview of the Biomedical Waste Rules 2016. It covers all the waste that we generate wherever we are doing the health-related activities. So, friends, it applies to everybody, to the big, large, small, factories, schools, the first aid posts, laboratories, everywhere. It applies to everybody. Nobody is exempted from the purview of the Biomedical Waste Rules 2016. All of these places are expected to take an authorization in a format and apply to the Pollution Control Board, seek the authorization, and put systems in place as per the rules. So nobody is spared wherever you are practicing in this country, either in the islands or on the seas under the geopolitical boundaries of this country, in the Himalayan plains or wherever. These rules applies to everybody. Nobody is spared or exempted from these rules, including our armed forces. Anyways, coming to the definitions, the key definitions are, which I think all of us should understand is, ಒಂದು authorized person is that person who is authorized to generate waste. That is, all of us are authorized to generate waste. So when we talk about an occupier, who is an occupier? Occupier is the head of the institution which is generating that waste. Operator is, very pertinently, it refers to the common treatment facility. So ಇದರಲ್ಲಿ ಏನೇನು ಕನ್ಫ್ಯೂಷನ್ ಇರಕೂಡದು ಅಂತ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ರೂಲ್ಸ್ ಅಲ್ಲಿ ಇದನ್ನ ಬಿಡಿಸಿ ಹೇಳಿದ್ದಾರೆ. So one take-home message, friends, to you all is, ಆಕ್ಯುಪೈರ್ ಅಂದ್ರೆ ನಮ್ಮ DHO ಸಾಹೇಬ್ರು ಅಥವಾ ನಮ್ಮ ಸಿವಿಲ್ ಸರ್ಜನ್ ಅಥವಾ ನಮ್ಮ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಟಿವ್ ಮೆಡಿಕಲ್ ಆಫೀಸರ್ ವಿಲ್ ಬಿ ರೆಸ್ಪಾನ್ಸಿಬಲ್ ಅಂಡ್ ಅಂತ ಅನ್ಕೋಬೇಡಿ. ವೈಲ್ ದಟ್ ದೀಸ್ ಅಫಿಷಿಯಲ್ಸ್ ಆರ್ ರೆಸ್ಪಾನ್ಸಿಬಲ್, ಬಟ್ ದ ಓನಸ್ actually boils down to the person who is generating the waste. If our administrative medical officer can tell, sir, nanella training adella madidini, the systems ella are in place, it is this particular individual who is failing to do the job, and then you are liable for punishment, so to speak. So adanna navu artha madkobeku. So each one of us are responsible, each one of us are accountable, and not just the heads of the institution when we talk about biomedical waste, friends. As regards to the operators of common biomedical waste treatment facility, our pollution control board officials are literally in touch with them. They will be in touch with these operators on a day-to-day basis, and they have a system going there. So even they too are covered under the purview of the biomedical waste rules, and they have been given a set of certain responsibilities as well, which I'm going to cover as we go on. So when we talk about, as coming to the composition of the biomedical waste itself, 100 kilograms of waste on the hospital generate madidre, adralli 15 kilo matra infectious and hazardous waste agirtade. Mikkida 85% waste, paper, food, material, the general municipal solid kind of a waste irtade. Only about 15 kilograms or 15% of that waste is infectious and hazardous. But the problem is, like Professor said, in many places, it is our indifference when it comes to segregating the waste. Undu needle sako. If you put just one needle into a full bucket full of container, a bucket full of waste, which is biodegradable waste or food waste, one needle adralli hakidre, even that bucket full of waste now will be considered as a biomedical waste. And it has to be packed in the yellow waste after removing the needle, and it has to be sent for incineration. It is that very challenging. So now when I segregate madidre, we can prevent this mixing of waste. So if we segregate, if we have a culture of segregation in the healthcare facility, we will end up only with managing this 15 kilograms of waste. But what is happening now? Because we are not segregating, this 15 kilograms gets mixed with the rest of the 85 kilograms of waste, rendering all of that 100 kilograms of waste to be handled by the hospital. Is it easy to manage 15 kilograms of waste or 100 kilograms of waste? It's obvious. It's easy to manage 15 kilograms of waste. The lesser the waste we generate, the easier will be it for us to manage. So therefore, friends, understanding the waste we are generating and segregating it becomes very important. I keep saying this many sessions. Segregation determines everything. Segregation is the heart. It is a soul. and it's a mind of waste management. No matter what containers, no matter what color codes, no matter what incinerators, ಏನೇ ನೀವು ಹೇಳಿ, segregation ಆಗದಿದ್ರೆ none of these things will work. That's why I say there's a human issue related to segregation. That's where I said it's a heart. If you segregate needles as such, then we are preventing an injury to our fellow colleagues, the waste handlers within the hospital. So that is about the heart. The soul of the waste management is everything that I have said in the morning, in my opening remarks. And the mind of the waste management is, once you segregate, containment, barcoding, ensuring that the red waste gets autoclaved, and then it gets shredding. All these things are the mind aspects of it. So therefore, friends, segregation is the heart, it's the soul, and is the mind of waste management. Segregation maradidre nothing will work. So please bear that in your mind. And whenever we talk about healthcare waste, discussion on healthcare waste is incomplete if we do not touch upon the municipal solid waste the hospitals generate. Like I said, a chunk of the waste that we generate in the hospitals is the municipal solid waste, which needs to be maintained, which needs to be managed as per the provisions of the Solid Waste Management Rules 2016. Dry waste and wet waste. Idr bagge solpa details I will speak as we go on. But a discussion on the biomedical waste is incomplete if we don't recognize that hospitals generate municipal solid waste, which has to be managed as per the provisions of the Solid Waste Management Rules. Please keep that in your mind. I have mentioned this already. These rules apply to everybody, from a single doctor clinic to a large tertiary care hospitals, including the hospitals which are under the armed forces. ನಾನು ಒಬ್ಬನೇ ಡಾಕ್ಟರು, ನಾನು ಇಷ್ಟೇ ಒಂದೇ ಎರಡು ನೀಡಲ್ಸ್ 4-5 ಸಿರಿಂಜ್ ಜನರೇಟ್ ಮಾಡ್ತೀನಿ, therefore I am exempted ಅಂತ ಅನ್ಕೋಬೇಡಿ. It applies to everybody. Now, the gist and substance of biomedical waste rules is, like I said, biomedical waste rules is like a guide. It is actually a friend. It's like now bidisi nodidre, it is not telling you if you do this, if you will be in trouble. No, it is telling you what you have to do, how it can be done. So it's like a guide for all of us. So this slide encapsulates it. So rules are, like I said, there are 4 schedules: Schedule 1, Schedule 3, Schedule 2, Schedule 3, and Schedule 4. All of those schedules are combined in this one slide. So what do they say? It gives us the categories of waste. ಆ ಕ್ಯಾಟಗರಿಗೆ ಯಾವ ಕಲರ್ ಕೋಡ್ ಅಲ್ಲಿ ಹೋಗ್ಬೇಕು, ಆ ಕಲರ್ ಕೋಡ್ ಅಲ್ಲಿ ಹೋಗುವಂತ ವೇಸ್ಟ್ಗೆ ಆ ಕಂಟೈನರ್ ಡಿಸ್ಕ್ರಿಪ್ಷನ್ ಅದು ಕೊಡ್ತದೆ. ಆ ಕಂಟೈನರ್ ಜೊತೆಗೆ ಅದರಲ್ಲಿ ಒಳಗಡೆ ಹಾಕ್ಬೇಕಾಗುವಂತ ಪಾಲಿಥಿನ್ ಲೈನರ್ಸ್ ಬಗ್ಗೆ ಡಿಸ್ಕ್ರಿಪ್ಷನ್ ಇದೆ. ಯಾವ ಥಿಕ್ನೆಸ್ ಇರಬೇಕು, ಲೈನರ್ ಯಾವ ತರ ಇರಬೇಕು ಅನ್ನೋದನ್ನ ಡೀಟೇಲ್ಸ್ ಕೊಟ್ಟಿದೆ. ಎಲ್ಲೋ ಅಲ್ಲಿ ಇರುವಂತಹ ವೇಸ್ಟ್ ನ ಯಾವ ತರ ಮ್ಯಾನೇಜ್ ಮಾಡ್ಬೇಕು, ರೆಡ್ ಅಲ್ಲಿ ಇರುವಂತಹ ವೇಸ್ಟ್ ನ ಯಾವ ತರ ಮ್ಯಾನೇಜ್ ಮಾಡ್ಬೇಕು, ಬ್ಲಡ್ ಬ್ಯಾಗ್ಸ್ ನ ಯಾವ ತರ ಮ್ಯಾನೇಜ್ ಮಾಡ್ಬೇಕು, ಬಾರ್ಕೋಡ್ ಯಾವ ತರ ಇರಬೇಕು, ಬಾರ್ಕೋಡ್ ಡಿಸ್ಕ್ರಿಪ್ಷನ್ ಏನು, ಇದೆಲ್ಲಾನು ಕೂಡ ನಮ್ಮ ರೂಲ್ಸ್ ಅಲ್ಲಿ ಅಡಗಿದೆ. ಸೊ like I said, it's a set of guidelines. So I have put this slide thanks to, I acknowledge Pollution Control Board's website for this slide. It is from there I have taken this from one of their resource material. So it gives you an overview as to how a waste management system should look like. And again, I'm repeating, a discussion on waste management is incomplete if we do not take into cognizance about the solid waste or the municipal solid waste that we generate in the hospitals. So adanna, as per the rules, biodegradable waste, food waste ityadi should go into a green container, and the other dry waste or the wet waste, papers ityadi, should go into a blue container, which should be labeled as such. And we have some amount of electronic waste and other things that has to go into the black color. Now coming to the yellow color code rules ali, we have the yellow, we have the red, we have the blue, and we have white translucent for puncture proof containers. Now yellow antakshane, it is meant to be treated by incineration or pyrolysis. Yellow on takshana, yellow color coded container and yellow polythene liner alliruvanta waste adu incinerate agbeku. Scientific burning, controlled burning is a way of treating it. ಅಲ್ಲಿ ಬಂದಿರುವಂತ ಆಶ್ ನ ನಾವು ಬ್ಲಾಕ್ ಬ್ಯಾಗ್ ಹಾಕೊಂಡು ಹಜಾರ್ಡಸ್ ವೇಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಫೆಸಿಲಿಟಿ ಐಡೆಂಟಿಫೈಡ್ ಪ್ಲೇಸ್ಗೆ ಲ್ಯಾಂಡ್ ಫಿಲ್ ಮಾಡೋದು. So if this is a case, friends, we have to ensure that into this yellow, no metal goes, no glass goes. Glass and metal, like you all know, cannot be incinerated. So therefore, we have to ensure that into the yellow, only cotton, dressings, anatomical waste should go. And there is a provision for containing certain pharmaceutical products, medical products, also to be contained in the yellow container. In the yellow container. So that means what? A hospital, for example, my own institution where I'm working, St. John's, we will have technically 3 yellow containers. In first yellow container, we will have human anatomical waste, animal model experiments ಜಾಸ್ತಿ ಮಾಡೋದಿಲ್ಲ, but for the sake of completion, I put animal anatomical parts, which our veterinary colleagues generate a lot. And solid waste such as cotton dressings, sanitary napkins, plaster of Paris, etc., and microbiology and that culture media, adunu kuda adu tumor tissues ityadi from pathology laboratories we get should go into yellow container. This is the first yellow container. Second yellow container is a dedicated yellow container for containing pharmaceutical waste. Pharmaceutical waste andre eno? Pharmaceutical waste andre eno? Expired drugs, partially used drugs, expired drugs, partially used drugs, or drugs which are leftovers, which are in the ward. That should go into yellow container. Fortunately, the experience thus far has been in our hospitals, we have a good system. Jasti expired drugs, jasti say way the generate moduzilla now. But akasmat enad madidre, it should go into a dedicated yellow container. And there has to be a third yellow container. Third yellow container is specifically for cytotoxic drugs, or genotoxic drugs, or chemotherapeutic drugs, what we call as. And these drugs are generated only in select few handful of hospitals, which have oncology units and specialized oncology centers such as Kidwai or Kiran Majumdar Shah Hospital in Bangalore City, which take care of cancer patients, wherein a lot of these cytotoxic drugs are used. And the hospitals, if at all they generate cytotoxic drug waste, then that has to go into a third container dedicated only for containing this waste. And it should have a C symbol on the container. And also on the polythene liner inside, it will have, along with the biohazard symbol, it will also have a C symbol. Photograph ide toristinanu. So technically, in a given hospital, there could be 3 yellow containers, friends. First yellow container only for anatomical waste and cotton dressings ityadi. Second, for only pharmaceutical, expired pharmaceutical or partially used pharmaceutical waste products. And third, if at all a hospital generates a third container for dedicated container for cytotoxic or chemotherapeutic drugs. So these pharmaceutical and cytotoxic drugs are picked up by the common treatment facility on a defined, dedicated, pre-agreed date with that hospital. But that system is there. We don't have to worry. It depends upon the hospital and the common treatment facility. But for the first container, which contains cotton dressings, anatomical waste, adike, it has to be cleared from the hospital within 48 hours. But pharmaceutical and cytotoxic drugs, it can be collected by the common treatment facility at a interval of 3 or 4 months, depending upon that waste that you generate. So as well as to pressure illa. But first container should be immediately cleared within 48 hours. So these are the few photographs just to give you an idea and complete this thought of mine. First yellow container. And the other thing which I have to mention is, I said in the yellow container, no glass, no metal, no plastic ಅಂತ ಹೇಳಿದ್ನ. The only exception is the blood bags. ನಮ್ಮ ಹಾಸ್ಪಿಟಲ್ಸ್ ಅಲ್ಲಿ ಬ್ಲಡ್ ಬ್ಯಾಗ್ ಅಥವಾ ಬ್ಲಡ್ ಪ್ರಾಡಕ್ಟ್ಸ್ ಅಥವಾ ಬ್ಲಡ್ ಬ್ಯಾಗ್ ಏನಾದ್ರು ನಾವು ಜನರೇಟ್ ಮಾಡಿದ್ರೆ ಆ ಬ್ಲಡ್ ಬ್ಯಾಗ್ಸ್ ಕೂಡ ಎಲ್ಲೋಗೆ ಹೋಗ್ಬೇಕು. ದ ಓನ್ಲಿ ಡಿಫರೆನ್ಸ್ ಇಸ್ ಬಿಫೋರ್ ಇಟ್ ಈಸ್ gets contained in the yellow container, it has to be first autoclaved, and only then it has to go into the yellow container. The only plastic that can go into the yellow container, first yellow container, is the blood bag, which is that too after autoclaving. The only exception is for the blood bags. So, right now, the blood bags that are getting manufactured in India, we understand from the authorities on the top is they are all made of chlorine-free plastic. So that let's not worry. But from the rules, they have made it clear: blood bags after autoclaving can go into the yellow bag. So this is how a blood bag would look at the end of the day. Just a visual for your idea. And ಈ ಮೈಕ್ರೋಬಯಾಲಜಿ ಇಂದ ಬರುವಂತ ಕಲ್ಚರ್ ಮೀಡಿಯಾ ಅದೆಲ್ಲ ಇದೆಯಲ್ಲ, ಅದನ್ನು ಕೂಡ should go into the yellow waste after autoclaving. This is a second yellow container which I mentioned, pharmaceutical waste again. The third yellow container will have a dedicated container with a C symbol along with the biohazard symbol. Now coming to the second, red is plastics, only plastics, nothing but the plastics and plastic solid fluids. Plastic, the only exception is the blood bags, which after autoclaving will go into the yellow. Otherwise, all other plastics and plastic-like material like vacuum, for example, will go into the red container. And we have to take little precaution here. Vacuum and sample collect ಮಾಡಿರುವಂತ containers microbiology ಸುಮಾರು ಬರ್ತದೆ ಅಂತದ್ದು. We have to ensure that we autoclave and then is handed over to the common treatment facility. Otherwise, syringes adella we don't have to autoclave, that can get contained in the red bag directly and can go. But vacuum and microbiological waste that we generate in the laboratories must be autoclaved and then put into the red. It is all this is being done to reduce the hazard, reduce the risk of infections. To our own colleagues within the hospital first, and also to the people who handle this waste subsequently. Friends, these slides will be shared with you by Empri training team. ನೀವೆಲ್ಲಾನು ಕೂಡ ಈ slides ನ utilize ಮಾಡಿಕೊಂಡು you can do training at your level. ಈ slides ನ you can modify and improvise and you can use it. That's why few slides we have put few extra sentences and all, so that there is some clarity on it. So like I just mentioned, infected medical plastics also will go into the red waste, but wherever indicated in the rules, they have to be autoclaved. Otherwise, IV bottles, syringes can go directly into the red. Then coming to the third color code, the blue color code. The blue color code is meant for two types of waste in the hospital. The first blue container is for the glass waste, such as IV bottles, glass slides, glass petri dishes which are broken, vials, ampules. The second blue container is meant for metal implants and prosthetics. This morning, I was talking to my infection control colleagues. Apparently, in our hospital, in orthopedic ward, we have some transplant metal implants that are generated. And they told that they're containing that in the blue container. So this waste also is not generated in many places. Only those hospitals which are trauma care units, which do a lot of orthopedic and related surgeries, only the second container hoguvanta waste marbodu. Otherwise, in most other places, it is only the glass waste that we generate. But friends, like yellow, there may be a possibility that the hospital will end up having two blue containers. The first blue container for glass and the second blue container for metal implants and prosthetics, if at all. And there's a description detail given in the rules about this blue container. It has to be a thick-bodied kg cardboard kind of a material. Photographs ಇದನ್ನ ನಾನು ತೋರಿಸ್ತೀನಿ. ಇದು leak proof container ಆಗಿರಬೇಕು. ಇದನ್ನ ಅಂತ ಕಂಟೈನರ್ಸ್ ಅಲ್ಲಿ ಕಂಟೈನ್ ಮಾಡಬೇಕು ಅಂತ ರೂಲ್ಸ್ ಹೇಳುತ್ತೆ. Leak proof, thick corrugated kg cardboard kind of waste containers with the blue liner inside again. Adರಲ್ಲಿ ಏನು ಕಾಂಪ್ರಮೈಸ್ ಇಲ್ಲ. So the blue color code containing glass and metal waste, just again to give you a visual and an idea. So this is how the blue container should look, friends. Nange artha agutte sumar kade nimmalli ee tara illa, but doesn't matter. Even if you take the kg cardboard that you have, adanna double containers use ಮಾಡಿ, ಎರಡೆರಡು ಯೂಸ್ ಮಾಡಿ, ಒಂದರ ಒಳಗಡೆ ಇನ್ನೊಂದು ಹಾಕಿ ಯೂಸ್ ಮಾಡಿ, thick ಆಗ್ತದೆ, and put two liners, blue liners, it will become leak proof. And adanna ನೀವು ಆಚೆಯಿಂದ blue scotch tape in the pack ಮಾಡಿದ್ರೆ it becomes blue color coded for now. But going forward, this is what is expected. ಈ ಫೋಟೋಗ್ರಾಫ್ ಅಲ್ಲಿ ಇರುವಂಗೆ ನಾವು ಮಾಡಬೇಕು in time to come. So this is one example just to show you. Nanna balagade and nimma balagade nodtiro ಒಂದು ಕಂಟೈನರ್ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಇಲ್ಲ, so they have taken this kg cardboard, double kg cardboard, blue scotch tape ಹಾಕಿದ್ದಾರೆ, so it is color coded. It should have a biohazard symbol and it should have a labeling of either if it is a glass or metal implants ಆಗಿದ್ರೆ metal implants. ವೇಸ್ಟ್ ಶಾಪ್ ಕಂಟೈನರ್ಸ್ ಬಗ್ಗೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಗೊತ್ತು, ನಾನು ಟೈಮ್ ವೇಸ್ಟ್ ಮಾಡೋದಿಲ್ಲ. ಎಲ್ಲಾ ನೀಡಲ್ಸ್, ಮೆಟಲ್ ನೀಡಲ್ಸ್ ಇನ್ಕ್ಲೂಡಿಂಗ್ ಇನ್ಸುಲಿನ್ ಸಿರಿಂಜಸ್ ಶುಡ್ ಗೋ ಇನ್ ಟು ದಿಸ್ ವೇಸ್ಟ್ ಶಾಪ್ ಕಂಟೈನರ್. ಇನ್ಸುಲಿನ್ ಸಿರಿಂಜಸ್ ಇಲ್ಲ ಡಾಕ್ಟ್ರೆ, ನಾವು ವಿ ವಿಲ್ ಕಟ್ ದ ನೀಡಲ್ಸ್ ಅಂಡ್ ಪುಟ್ ದ ಸಿರಿಂಜ್ ಇನ್ ಟು ರೆಡ್ ಅಂಡ್ ನೀಡಲ್ ಇನ್ ಟು ಪಂಕ್ಚರ್ ಪ್ರೂಫ್ ಕಂಟೈನರ್ ಅಂದ್ರೆ ಐ ವಿಲ್ ನಾಟ್ ಡಿಸ್ಕರೇಜ್ ಯು. ಪ್ಲೀಸ್ ಡೂ ಇಟ್, ಬಟ್ ಡೂ ದಟ್ ವಿತೌಟ್ ಕಾಸಿಂಗ್ ಹಾರ್ಮ್ ಟು ಯುವರ್ ಸೆಲ್ಫ್. ಅಲ್ಟಿಮೇಟ್ಲಿ ನಾವು ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಮಾಡ್ತಾ ಇರೋದು ಟು ಪ್ರಿವೆಂಟ್ ಹಜಾರ್ಡ್ ಟು ಅವರ್ ಓನ್ ಸೆಲ್ಸ್. ಇದನ್ನ ನಾವು ಕಟ್ ಮಾಡಿ ತುಂಡಾಗಿ ಇದು ಮಾಡುವಾಗ ಇಫ್ ಯು ಎಂಡ್ ಅಪ್ ಇಂಜೂರಿಂಗ್ ಯುವರ್ ಸೆಲ್ಫ್, ದೆನ್ the whole objective is lost. No problem, you can separate the needle from the syringe and put syringe into the red and needle into the puncture proof container, no problem. As an extra measure of safety, we promote the use of concentrated bleach solution for these puncture proof containers, so that the needles which go there get disinfected and also get rusted also. In a small observation we have done in my own department, we have seen that bleach solution ಅಲ್ಲಿ ಇರುವಂತ ಮೆಟಲ್ in about 21 days, 3 weeks time ಅಲ್ಲಿ ಅದು ಸ್ವಲ್ಪ ತುಕ್ಕು ಹಿಡಿದೋಗುತ್ತೆ. So technically in single person's hand, in single touch, you are achieving segregation, containment, disinfection and disfigurement also. ತುಕ್ಕು ಹಿಡಿಯುತ್ತಲ್ಲ, disfigurement, nobody will be able to use it again. So that is for your consideration, friends. But ensure that every piece of sharp goes into the puncture proof container. So this is again one more slide to give you an idea. So all in all, friends, containers that we use for biomedical waste should be of good quality. ಎಲ್ಲೆಲ್ಲಾಗುತ್ತೋ ಅದು no touch containers ಆಗಲಿ ಅಥವಾ paddle operated lid operated paddle operated ಹಿಂಗ ಕಾಲಲ್ಲಿ ಒತ್ತಿದ ತಕ್ಷಣ paddle lid ಓಪನ್ ಆಗುತ್ತೆ ಅಂತ ಕಂಟೈನರ್ಸ್ ಆಗಿರಲಿ. ಕಲರ್ ಕೋಡೆಡ್ ಅಪ್ರಾಪ್ರಿಯೇಟ್, ಯೆಲ್ಲೋ ಅಂದ್ರೆ ಯೆಲ್ಲೋನೇ ಇರಬೇಕು, ಹೋಲ್ ಬಾಡಿ ಯೆಲ್ಲೋ ಇದ್ರೆ ಐಡಿಯಲ್, ಹೋಲ್ ಬಾಡಿ ರೆಡ್ ಇದ್ರೆ ಐಡಿಯಲ್, ಹೋಲ್ ಬಾಡಿ ಬ್ಲೂ ಇದ್ರೆ ಐಡಿಯಲ್. ಸೊ ಅಂತ ಕಂಟೈನರ್ಸ್ ನೇ ನೀವು ಆಯ್ಕೆ ಮಾಡಿ. ಅಂಡ್ ಒಳಗಡೆ ಇರುವಂತ ಪಾಲಿಥಿನ್ ಲೈನರ್ ಶುಡ್ ಬಿ ಆಫ್ ದ ಸೇಮ್ ಕಲರ್, and both the container and the polythene liner should have biohazard symbol. Cytotoxic drugs ಅಕಸ್ಮಾತ್ ನಾವು ಕಂಟೈನ್ ಮಾಡ್ತಾ ಇದ್ರೆ C symbol in addition it should have. This I mentioned already. And other thing that is expected in the hospital as per the rules, 2016 rules, friends, is for us to have a barcode system for waste management. Namma hospital alli generate agi ಆಚೆ ಹೋಗ್ತಾ ಇರುವಂತ ಯೆಲ್ಲೋ ಬ್ಯಾಗ್ ಆಗಿರ್ಲಿ, ರೆಡ್ ಬ್ಯಾಗ್ ಆಗಿರ್ಲಿ, ಬ್ಲೂ ಬ್ಯಾಗ್ ಆಗಿರ್ಲಿ ಅಥವಾ ಪಂಕ್ಚರ್ ಪ್ರೂಫ್ ಕಂಟೈನರೇ ಆಗಿರ್ಲಿ, ಅದರ ಮೇಲೆ ಬಾರ್ ಕೋಡ್ ಇರಬೇಕು ಅಥವಾ QPR ಕೋಡ್ ಇರಬೇಕು. That barcode or QPR code, in that code, in a code, when you read that code with the infrared gun, it will tell from which hospital this waste has come, what is the category of this waste, from which ward it has come, on what date it has been collected, what is the weight of this waste. ಇದೆಲ್ಲ ಕೂಡ ಆ ಬಾರ್ಕೋಡ್, ಆ ಕೋಡ್ ಅಲ್ಲಿ ಅಡಗಿದೆ ಇನ್ಫಾರ್ಮೇಶನ್. ಸೊ ಬಾರ್ಕೋಡ್ ಸಿಸ್ಟಮ್ is very, very important, and it is expected by the rules that we have this in place. In fact, 2019 March ಒಳಗಡೆ ನಾವು ಮಾಡಬೇಕಾಗಿತ್ತು, but in many places we are still struggling. But our pollution control board officials understand this. Till such time, you have to ensure that the plastic bags are labeled. ಮಾರ್ಕರ್ ಪೆನ್ ತಗೊಂಡು ಪ್ಲಾಸ್ಟಿಕ್ ಬ್ಯಾಗ್ ನಿಮ್ಮ ಹಾಸ್ಪಿಟ್ಲು ಯಾವ ವಾರ್ಡು ಯಾವ ಡೇಟು ಹ್ಯಾಂಡ್ ಓವರ್ ಮಾಡ್ತಾ ಇರೋರು ಯಾರು ಅನ್ನೋದನ್ನ ನೀವು ಕೈಯಲ್ಲಿ ಬರಿಬೇಕಾಗ್ತದೆ. ಬಟ್ ದಟ್ ಈಸ್ ನಾಟ್ ಎನ್ಕರೇಜ್ ಟು ಕಂಟಿನ್ಯೂ, ದಟ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಡನ್ ಅವೇ ವಿತ್, ಅಂಡ್ ಯುವರ್ ಹಾಸ್ಪಿಟಲ್ ಶುಡ್ ಮೂವ್ ಟುವರ್ಡ್ಸ್ ಬಾರ್ಕೋಡ್ ಸಿಸ್ಟಮ್ ಆಫ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್. ಅದ್ರ ಬಗ್ಗೆ ಒಂದು ಸೆಷನ್ ಇದೆ, ಆಪ್ ಇದೆ, ಅದರ ಬಗ್ಗೆ ನಮ್ಮ ಕಲೀಗ್ಸ್ ನಿಮಗೆ ಹೇಳ್ಕೊಡ್ತಾರೆ ಇವತ್ತಿನ ಸೆಷನ್ ಅಲ್ಲಿ. So these are the details that are captured in that barcode. Now, ಆ ತರ ನಾವು ಜನರೇಟ್ ಮಾಡಿ ಕಲರ್ ಕೋಡ್, ಅಪ್ರಾಪ್ರಿಯೇಟ್ ಕಲರ್ ಕೋಡ್ ಕಂಟೈನರ್ಸ್ ಅಲ್ಲಿ ಇದು ಕಂಟೈನ್ ಆಗಿ, ಮತ್ತೆ ಬ್ಯಾಗ್ ನ ನಾವು ಕಂಟೈನರ್ ತೆಗೆದಾದ್ಮೇಲೆ ಸ್ಟೋರೇಜ್ ಪ್ಲೇಸ್ ಅಲ್ಲಿ ಇಟ್ಟಾದ್ಮೇಲೆ, ಸ್ಟೋರೇಜ್ ಪ್ಲೇಸ್ ಇಂದ ನಮ್ಮ ಕಾಮನ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಫೆಸಿಲಿಟಿ ಅವರು ಇನ್ ಡೆಡಿಕೇಟೆಡ್ ವೆಹಿಕಲ್ ನ ಈ ವೇಸ್ಟ್ ನ ತಗೊಂಡು ಹೋಗ್ತಾರೆ. ಅಲ್ಲಿ ತಗೊಂಡು ಹೋಗುವಾಗೂ ಕೂಡ ಎಲ್ಲ ಡಂಪ್ ಮಾಡ್ಕೊಂಡು ಹೋಗಲ್ಲ. ಈ ಫೋಟೋಗ್ರಾಫ್ ಅಲ್ಲಿ ನೋಡ್ತಾ ಇರುವಂಗೆ ಆ ವೆಹಿಕಲ್ ಅಲ್ಲಿ ಚೇಂಬರ್ಸ್ ಇರ್ತದೆ. ಯೆಲ್ಲೋ ವೇಸ್ಟ್ ಯೆಲ್ಲೋ ಚೇಂಬರ್ಗೆ ಹೋಗ್ತದೆ, ರೆಡ್ ವೇಸ್ಟ್ ರೆಡ್ ಚೇಂಬರ್ಗೆ ಹೋಗ್ತದೆ, ಬ್ಲೂ ವೇಸ್ಟ್ ವಿಲ್ ಗೋ ಟು ದ ಬ್ಲೂ ಚೇಂಬರ್ ಅಂಡ್ ಪಂಕ್ಚರ್ ಪ್ರೂಫ್ ಕಂಟೈನರ್ಗೆ ಸಪರೇಟ್ ಚೇಂಬರ್. ಆ ವೆಹಿಕಲ್ ಅಲ್ಲಿನೂ ಕೂಡ ಈ ಸೆಗ್ರಿಗೇಷನ್ ರೋಡ್ ಅಲ್ಲಿ ಹೋಗ್ತಾನೂ ಕೂಡ ದ ವೇಸ್ಟ್ ಗೋಸ್ ಇನ್ ಅ ಸೆಗ್ರಿಗೇಟೆಡ್ ವೇ ಅಪ್ ಟಿಲ್ ದ ಕಾಮನ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಫೆಸಿಲಿಟಿ. ಸೊ ಪ್ಲೀಸ್ ಬೇರ್ ದಟ್ ಇನ್ ಯೋರ್ ಮೈಂಡ್. And all of the hospitals, ನಮ್ಮ ಫಸ್ಟ್ ಆರ್ ಸೆಕೆಂಡ್ ಟ್ರೈನಿಂಗ್ ಸೆಷನ್ ಅಲ್ಲಿ ನಮ್ಗೊಂದು ಕ್ವಶನ್ ಬಂತು, ಇದು ಸರ್ ಸಿಂಗಲ್ ಡಾಕ್ಟರ್ಸ್ ಇದ್ದಾರೆ, ಅವರು ಸುಮಾರು ಜನ ಹೆಸಿಟೇಟ್ ಮಾಡ್ತಾರೆ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ರೂಲ್ಸ್ಗೆ ಅಪ್ಲೈ ಮಾಡಿ ಅಥರೈಸೇಷನ್ ತಗೊಳ್ಳೋದಕ್ಕೆ ಅಂತ. ಅವ್ರು ಭಯ ಪಟ್ಕೊಂಡ್ರೆ ಕೆಲಸ ಆಗ್ತು. ನಾನು ಹೇಳ್ದಂಗೆ ಒಬ್ಬ ಡಾಕ್ಟರ್ ಇದ್ರು ಕೂಡ ಅವರು ಅಥರೈಸೇಷನ್ ತಗೊಳ್ಳೇಬೇಕು. Nobody is exempted from linking from authorizing, and nobody is exempted from linking to the common biomedical waste treatment facility. As regards to the costing, ಎಷ್ಟು ಕಾಸ್ಟ್ ತಗೋಬೇಕು ಅವರೆಲ್ಲ ನೀವು ಅವ್ರು ನೆಗೋಷಿಯೇಟ್ ಮಾಡ್ಕೊಳ್ಳಿ, ಬಟ್ you have to link up to a common biomedical waste treatment facility. There is no exception, even if you generate one single syringe. So the only exceptions are in certain geographic areas. Common biomedical waste treatment ಸುಮಾರು ದೂರದಲ್ಲಿದೆ, not within the prescribed radius. ಅಂತವರಿಗೆ Pollution Control Board has made a provision for they having their own waste shark pit and deep burial pit. ಆ waste shark pit nu kuda yav tara irbeku, deep burial pit yav tara irbeku, idikke that sanitary engineering details also have been prescribed. So but this should happen only after taking a permission from the Pollution Control Board of your area. Liquid waste, friends, always a challenge. Again, thanks to Karnataka Health Systems Development Reforms Project, Adralli Ravi Auru and his team have given our state a very good resource. Chick hospitals alli where there is no effluent treatment plants, anta hospitals alli now generate ಮಾಡ್ತಾ ಇರುವಂತ infectious liquid na ಯಾವ ತರ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಮಾಡಬಹುದು, with a little bit of a plumbing detail, with a little bit of civil engineering detail. ಅದಕ್ಕೊಂದು ಮ್ಯಾನ್ಯುಯಲ್ ತರನೇ visual description ತರನೇ ಕೊಟ್ಟಿದ್ದಾರೆ. We have urged our MPRI team to supply these guidelines to all of you. ನನ್ನ ಪ್ರಕಾರ it's already there in many hospitals, but anyway, as a part of this training program, you all will be given that civil engineering plan and the plumbing plan to manage your liquid waste. So don't worry about it. This is how it will look in smaller hospitals, but in bigger hospitals, no exception, no excuses. Bigger hospitals, effluent treatment plant. In my own institution, we struggled a lot, but finally we have a effluent treatment plant in place. Likewise, in many big hospitals, we have effluent treatment plants. This is only for those hospitals which are like primary health centers and other such small places. Now, friends, biomedical waste andagne, it is not about containers and color code and barcode, etc., incinerators, pyrolysis. Into biomedical waste andaga, it also is about occupational safety, which Dr. Prithvish has mentioned in the morning. When we institute systems for biomedical waste, the biggest beneficiaries are our own colleagues in the hospital. Needle stick injuries immediate kadme agtide, and all in all, you will see an observation. There is a positive environment built in the hospital, in the wards. Once the waste is segregated, there's aesthetics of the whole place improves, and we have many such examples, friends. So it's about occupational safety also. Every year, once a year, we have to get the medical checkup done for our waste handlers. Immunization has to be done for them, and periodic training has to be done for them. And nothing orally, everything should be daklified. Pratyondukku dakle irbeku. Visual, and in some places they also take video clips, which I strongly encourage. And injuries na record ಮಾಡಬೇಕು, accidents na record ಮಾಡಬೇಕು, needle stick injury ಇರಲಿ, cut injuries ಇರಲಿ ರೆಕಾರ್ಡ್ ಮಾಡಬೇಕು. ಅಕಸ್ಮಾತ್ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಏನಾದ್ರು ಅದು ವೇಸ್ಟ್ ಟ್ರಾಲಿ ಹೋಗುವಾಗ ಟ್ರಿಪ್ ಆಯ್ತು, ಸ್ಪಿಲ್ ಆಯ್ತು, ದೆನ್ ಶಾರ್ಟ್ ಸರ್ಕ್ಯೂಟ್ ಆಯ್ತು, ಏನಾದ್ರು ಫೈರ್ ಹಜಾರ್ಡ್ ಆಯ್ತು ಅಂದ್ರೆ ಅದನ್ನು ಕೂಡ ನೀವು ರೆಕಾರ್ಡ್ ಮಾಡಬೇಕು ಇನ್ ಅ ಪ್ರಿಸ್ಕ್ರೈಬ್ಡ್ ಫಾರ್ಮ್ಯಾಟ್ ವಿಚ್ ಇಸ್ ದೇರ್ ಇನ್ ದ ರೂಲ್ ಬುಕ್. So recording and reporting is also one important aspect of the rules. The other requirements of the biomedical waste rules are we have to have a biomedical waste or a health infection control committee. This committee should meet regularly. It should identify problems, and not just identifying the problems. It should be a place where solutions are given to the problems, identified problems. And this also minutes have to be recorded, and it is a minutes register should be kept in place. If at all our environment officials and all, for audit purpose, if they come, we are expected to show them these records. And hospitals are also expected to comply with few other rules apart from the biomedical waste rules and municipal solid waste management rules. We are also expected to take care of our e-waste as per the electronic waste management rules 2016. Chemicals use ಮಾಡ್ತೀವಿ, ಆ chemicals na hazardous waste rules ಅನುಗುಣವಾಗಿ ಯೂಸ್ ಮಾಡಬೇಕಾಗ್ತದೆ, manage ಮಾಡಬೇಕಾಗ್ತದೆ. And few specialized hospitals which generate radioactive waste, they should manage this radioactive waste as per the Department of Atomic Energy Baba Atomic Research Center guidelines ಇದೆ. ಅದರ ತಕ್ಕಂಗೆ you have to manage this waste, which many hospitals they do actually. So this is a biohazard symbol, a visual for your idea. Occupational safety ಬಗ್ಗೆ ಮಾತಾಡ್ತಾರೆ ನಮ್ಮ colleagues Akshay and Narasimha ಅವರು, but it is again to give you an idea what do we mean by occupational safety. These are the basic occupational safety equipment. It came into focus during the COVID times. But even before COVID times, it was always insisted in the biomedical waste sessions, the importance of personal protective equipment. So managing COVID waste is no different from managing other infectious diseases that generate in the hospitals. It's just that COVID waste now in extra care in the manage ಮಾಡಬೇಕಾಗ್ತದೆ. Double bagging is a norm, and labeling the COVID waste as such COVID waste anta is required on the plastic bags, because the common treatment facility ಅಲ್ಲಿ ಈ ವೇಸ್ಟ್ ನ ಪ್ರಯಾರಿಟೈಸ್ ಮಾಡಿ ಇದನ್ನ ಬೇಗ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ತಾರೆ. ಇದ್ರ ಬಗ್ಗೆ ಡೀಟೇಲ್ಸ್, ಡೋಂಟ್ ವರಿ, my colleagues Dr. Akshay and Narasimha are going to tell you these details, don't worry. So all I'm telling here is COVID-19 and even special extra ಏನilla. The concept, the principles are the same. Segregation, color code systems are the same. The only extra things are double bagging and labeling as COVID-19 based. So this I've already elaborated, friends. So these are the few pictures for your idea. This is a trolley. This is a dedicated biomedical waste. Sumar kade biomedical waste go ಒಂದು ಮೂಲೆಯಲ್ಲಿ ಕೊಟ್ಟು ಬಿಡ್ತಾರೆ. ಇಲ್ಲ, please engineer that biomedical waste storage area. Give it a civil engineering detail. Let it be safe and secure place, which has access to water and restrooms, and the area should be made pest proof. ಸ್ವಲ್ಪ ನ್ಯಾಚುರಲ್ ಲೈಟ್ ವೆಂಟಿಲೇಷನ್ ಇರುವಂತ ಪ್ಲೇಸ್ ನ ನಾವು ಚೂಸ್ ಮಾಡಬೇಕಾಗ್ತದೆ. ಸೊ ದೇರ್ ಇಸ್ ಅ ಸಿವಿಲ್ ಇಂಜಿನಿಯರಿಂಗ್ ಡೀಟೇಲ್ ದಟ್ ಇಸ್ ದೇರ್. ಯು ಹ್ಯಾವ್ ಟು ಕನ್ಸ್ಟ್ರಕ್ಟ್ ದ ಸ್ಟೋರೇಜ್ ಪಾಯಿಂಟ್ ಆಸ್ ಸಚ್. ಸುಮ್ಮನೆ ಯಾವುದೊಂದು ಮೂಲೆಯಲ್ಲಿ ಒಂದು ರೂಮಲ್ಲಿ ಹಾಕೋದಲ್ಲ. So this is the bar-coded or the QPR-coded yellow bag which is getting weighed, and weight na app ಮೂಲಕ we are taking those details, which is going to be discussed with you in one of the sessions today. This is a storage area. Wardalli ಯಾವ ತರ segregate ಮಾಡಿದ್ವಿ ಅದೇ ತರ segregated way, in a segregated way it is getting stored here. This is for those places which Pollution Control Board has given a permission to have their own Vesha pit. Vesha pit idre hing kanistade. Deep burial pit agidre this is how it will be. But all these things to only the select hospitals after prior permission from the Pollution Control Board. So friends, like I mentioned earlier, I'm mentioning this again, a discussion on biomedical waste is incomplete if you do not take into cognizance managing municipal general waste correctly. As per the Solid Waste Management Rules 2016, the biodegradable waste, or the non-biodegradable waste, wet waste or the dry waste, whichever the way you want to discuss it. So there is a story which I grew up with. It's at MS Ramaya where I studied. It's a story about 4 friends: anybody, nobody, everybody, somebody. Anybody thought everybody will do it, but it ended up that nobody did what anybody could have done. So it so happened that everybody started blaming the other fellow. Our discussion on waste management should not be like the story of these 4 friends. It should start with our own selves. It should start with I, and it should end with we all. So friends, with this, I wish there was more time. I could have taken you the story, but I hope you got the gist of it. So thank you all, friends, and God bless you. Thank you all very much for your patience. And these are the few resources that I've used for today's presentation. Thank you all very much.
Thank you, sir. If participants has any questions, the session is open for discussion.
Good afternoon, sir. Sir, am I audible?
Namaskara.
Sir, I am Dr. Rajans. I am microbiologist, professor in ESIC Medical College, Gulbarga, sir.
Okay, sir.
And sir,
Namaskara,
I'm looking after biomedical waste management also.
Okay,
So
doctor.
my query is, sir, as per BMW committee guidelines, we have to take daily rounds or we have to do inspection of biomedical waste management. So in this particular step, does the biomedical waste nodal officer, as I'm a professor, sir, I have other things to do. So I'm not able to accompany daily with the nursing staff. So is there any special post our biomedical waste means Central Pollution Control Board can create so that that person will be at least 9 to 4 will be available to look after all these things?
Okay, that way, if you look at the rules now, rules is very clear about it. It also tells you about a committee. You all in your hospital can decide about having a nodal person and delegate that responsibility to that person. That is to be done at an institutional level, doctor.
Okay,
No
sir.
rule will tell us to create jobs and create extra human resource. Rules will only give us a guideline. And in the biomedical waste rules, if you look at the rules little detail, it will describe your committee as well. From among your own team, you can identify one person to be the nodal person.
Okay, sir.
Ultimately, doctor, just to put this into perspective, and I'm speaking this even from our own hospital. While there is a member secretary, while there are our infection control nurses, I don't even recollect on one single day wherein a finger was pointed at a one direction. It is a team effort, and the team takes responsibility for it, doctor. I think that's the same. That should be the same everywhere. Only when we look at the whole thing as a teamwork, it will work into place. But I do understand there has to be one nodal person. It is all left to you, doctor. You can identify who that nodal person is and give that person that responsibility and authority.
Thank you, sir.
And document. And document
Yes,
it, doctor.
That is what, sir.
Dakle is very important.
My
In this
main worry,
hospital,
sir,
this is what we do.
Yes, sir. That my main worry is due to such responsibilities not given clearly, the work which should have been done, as sir said, I congratulations to yourself and Prithvi sir, for giving us such a nice guideline. But the thing is that, sir, as sir said, we should be consistently or repeatedly doing one thing. I feel that is lacking due to one reason, that the committee doesn't think that daily biomedical waste management should be supervised. That was my main concern, sir. Thank you, sir.
Doctor, again, I'm coming back to, I hope I have conveyed. Doctor, there is a committee. Within your committee, you can delegate this to, you can identify maybe 1 or 2 nurses. Like, for example, in our hospital, we have one gentleman, a health inspector, and also infection control nurses who take care of this. They just not take care of the biomedical waste. They also look at patient safety. They also have other infection. Like Professor said, biomedical waste is not about containers, color codes, and TAGA. It is all about infection control as well. So hospital infection control in a workplace also is a mandate of the team. So that's new delicate ಮಾಡ್ಕೊಳ್ಳಿ, doctor.
Yes, sir. Thank you, sir. Thank you for
you have to be constantly, doctor. It will not fall into place immediately. You have to be constantly at it. Only when you are constantly at it, things will fall into place.
Yes, sir. Sure, sir.
And you will face a lot of challenges. Mind you, doctor, you will face a lot of challenges. Be mentally prepared for it.
Okay, sir. Thank you.
Okay. But we are with you, and you can use us as sounding board for anything, and anything that is possible from our end, we will share with you.
Yeah, thank you, sir. Thank you so much.
Okay, doctor. Okay.
Thank you, sir. Thank you, sir. That was a very informative session.
Thank you.
Thank
you, Pooja.
We'll have question and answer session at the end. Sir, can we have question and answer session at the end? So that,
Yeah, you can, and participants can type in their questions in the chat box, Pooja, and
Yes,
please
sir.
share your email ID with them, no, so that they can type questions and send it to you also, and we will get back to all of those questions,
Yes, sir. Sure, sir.
like we have done in the past.
Yes, sir.
We will do that.
Yes, sir.
So once again, thanks to all of our Kalburgi friends. Thanks a lot. Thank you.
Thank you, sir. Now, I would like to call upon Dr. Akshaya KM, sir, Additional Professor, Community Medicine, Enepoya Medical College, Mangaluru. He will be talking on gap analysis in biomedical waste management. I welcome you, sir. Akshay, sir.
Yeah, good afternoon. Namaskara ಎಲ್ರಿಗೂ. Sir, Pooja, can you mute the participants because there have been some amount of disturbances.
Yes, sir.
Okay, fine. Thank you. Yes, so is the first slide visible?
Yes, sir.
Okay.
It's
fine.
visible, sir.
Thanks. Yeah, thanks Empri team for having given this opportunity. And over the next 15 to 20 minutes or so, we'll look upon some gap analysis in biomedical waste management. That means even though ಜೈವಿಕ ತ್ಯಾಜ್ಯವನ್ನ ನಿರ್ವಹಣೆ ಮಾಡಬೇಕಾದ್ರೆ ಯಾವ ತರದ ಒಂದು ಕುಂದುಕೊರತೆಗಳು ನಮ್ಮ ಕರ್ನಾಟಕದಲ್ಲಿ ಅಥವಾ ರಾಷ್ಟ್ರದಲ್ಲಿ ಕಂಡು ಬಂದಿದೆ, and what are these gaps and how to address these gaps. So gaps on identify ಮಾಡಿದ್ರೆ ಆಗಿಲ್ಲ, ಅದಕ್ಕೆ solutions ಕೂಡ ಅಷ್ಟೇ ಮುಖ್ಯವಾದದ್ದು. So we'll look upon certain solutions also at the end. So in the presentation, we'll see the biomedical waste management scenario in India and Karnataka. We'll see what are the performance indicators which have been set by Central Pollution Control Board as far as management of biomedical waste is concerned. So some of them are at the healthcare facilities, some of them are at the common biomedical waste treatment facilities, and some of them are at the policy level. So we'll see what are these indicators which have been set up, and then we'll see what are the gaps at healthcare facility level at the common biomedical waste treatment facilities, as well as some of the gaps at the administrative levels, and then we'll conclude the presentation with some solutions. So 2019 biomedical waste management scenario nodaga, this is pre-COVID. So the number of healthcare facilities in India are around 3.2 lakhs. And out of them, if we see, majority of them are non-bedded healthcare facilities. Andre ಇವೆಲ್ಲ ಪಾಲಿಕ್ಲಿನಿಕ್ಸ್ ಇರ್ಬೋದು ಅಥವಾ ಸಿಂಗಲ್ ಡಾಕ್ಟರ್ ಆಪರೇಟೆಡ್ ಕ್ಲಿನಿಕ್ಸ್ ಇರ್ಬೋದು. ಸೊ ಈ ತರದ ಒಂದು ಕ್ಲಿನಿಕ್ಸ್ ಆಲ್ಮೋಸ್ಟ್ 60 to 70% ಆಫ್ ದೀಸ್ healthcare facilities are constituted by non-bedded healthcare facilities. And ಈ ಒಂದು ಟೋಟಲ್ ನಂಬರ್ ಆಫ್ ಫೆಸಿಲಿಟೀಸ್ ಇಂದ ನಮ್ಮ ಹತ್ರ ಒಂದು 25 ಲಕ್ಷ ಬೆಡ್ಸ್ ಇದೆ. ಸೊ ಇಫ್ ವಿ ಸಿ ದ ಕಾಮನ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಫೆಸಿಲಿಟೀಸ್, they are 202 in operation and around 35 are under installation. So but authorization ಕೊಟ್ಟಿರೋ healthcare facilities ಅಂದ್ರೆ almost 50% ಅಷ್ಟೇ ಇರೋದು. ಅಂದ್ರೆ authorization for managing and collection of healthcare waste. So some of the health facilities have captive treatment facilities. ಅಂದ್ರೆ ಈ healthcare facilities ಗೆ CBWTF ಕವರೇಜ್ ಇಲ್ಲದೆ ಇರ್ಬೋದು. ಸೊ ಅವರಿಂದ ಹೆಲ್ತ್ಕೇರ್ ವೇಸ್ಟ್ ಅನ್ನ ಕಲೆಕ್ಟ್ ಮಾಡದೇ ಇರೋ ಪ್ರಸಂಗದಲ್ಲಿ ಅವರಿಗೆ ಕ್ಯಾಪ್ಟಿವ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಫೆಸಿಲಿಟೀಸ್ ಆಪರೇಟ್ ಮಾಡಲಿಕ್ಕೆ ಪರ್ಮಿಷನ್ ತಗೊಂಡಿದ್ದಾರೆ ಅವರು. ಅಂಡ್ ದೆರ್ ಆರ್ ಸಮ್ ಇನ್ಸಿನರೇಟರ್ಸ್ ವಿಚ್ ಆರ್ ಬೀಯಿಂಗ್ ಆಪರೇಟೆಡ್ ಬೈ ಹೆಲ್ತ್ಕೇರ್ ಫೆಸಿಲಿಟೀಸ್ ದೆಮ್ಸೆಲ್ವ್ಸ್. ಸೊ ಈ ಒಂದು ನಂಬರ್ 136 ಇದೆ. ಸೊ ಈ ಲಾಸ್ಟ್ ಎರಡು ಪಾಯಿಂಟ್ಸ್ ನಾನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ, ಇದನ್ನ they have to obtain special permission from pollution control boards to have these two. Otherwise all the healthcare facilities should come under the ambit of the collection of biomedical waste by common biomedical waste treatment facilities and their further management. So 2019 prakara, if we see, the biomedical waste generated in India constitutes to almost 600 odd tons, and of that we can see around 544 tons is being treated. That means around 60 to 70 tons of biomedical waste goes untreated every day. And the amount of biomedical waste disposed by deep burial is 74 tons per day. Coming to some of the states of Assam, Bihar, Chhattisgarh, Jammu Kashmir, Nam Karnataka Kuda, and Kerala, Madhya Pradesh, Maharashtra, and some of the northeastern states, there was a gap in generation and treatment of biomedical waste. 28 states have arrangements for environmentally safe disposal. And as I have already told, there are 202 authorized CBWTFs, that is common biomedical waste treatment facilities. Some smaller states like Goa, Andaman Nicobar, Arunachal Pradesh, Lakshadweep, Mizoram, Nagaland, and Sikkim do not have common biomedical waste treatment facilities. So these are all the informations. Idella information Central Pollution Control Board or website alle ide. So it is all open in the public domain. So there is no hidden documents or any unshared documents with respect to this information. So everything is in the public domain. Karnataka one scenario nodidaga, Karnataka generates around 77.5 tons of biomedical waste every day, and out of this only 36 tons are treated. That means we actually treat less than 50% of the biomedical waste which is generated in Karnataka, and that's a very disturbing figure. And we have around 27 common biomedical waste treatment facilities. So violations, nodaga around 4,000 violations were there from the state of Karnataka during 2019, and show cause notices have been issued to 905 of them. ಆಮೇಲೆ ಈ ಕೋವಿಡ್ ಅಂತ ಒಂದು ಪ್ಯಾಂಡಮಿಕ್ ಬಂದಿರೋದ್ರಿಂದ we can see that the amount of waste which is being generated has drastically increased. And if we see the December 2021 data, andre it is the time when there was a lull, that means the number of cases of COVID had comparatively come down before the third wave. So ee time alli ಒಂದು ನಮ್ಮ biomedical waste tracking app prakara now almost 23 tons of biomedical waste was being generated across India, and adralli around 1.1 tons of biomedical waste, COVID biomedical waste, was generated in Karnataka, and 10 common biomedical waste treatment facilities were engaged in managing this particular waste across the state of Karnataka. So ಈ ಪರ್ಫಾರ್ಮೆನ್ಸ್ ಇಂಡಿಕೇಟರ್ಸ್ ಕೆಲವೊಂದು ಸೆಂಟ್ರಲ್ ಪೊಲ್ಯೂಷನ್ ಕಂಟ್ರೋಲ್ ಬೋರ್ಡ್ ಅವರು ಹಾಕಿದ್ದಾರೆ. ಅಂದ್ರೆ ಈ ಒಂದು ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಜನರೇಷನ್ ಹೇಗೆ ನಡೀತಾ ಇದೆ ಮತ್ತೆ ಅದರ ಬಗ್ಗೆ ಇರೋ ಕೆಲವೊಂದು ಮಾಹಿತಿಗಳನ್ನ ಹೇಗೆ KSPCB ಆರ್ ಪೊಲ್ಯೂಷನ್ ಕಂಟ್ರೋಲ್ ಬೋರ್ಡ್ಸ್ ಇಂದ ಬೇರೆ ಬೇರೆ ಫೆಸಿಲಿಟೀಸ್ಗೆ ಹೋಗಿದೆ, ಮತ್ತೆ ಅಲ್ಲಿ ನಡೆಯುವಂತ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅನ್ನ ಹೇಗೆ ಎಫಿಷಿಯೆಂಟ್ಲಿ ಮಾಡ್ತಾ ಇದ್ದಾರೋ ಇಲ್ಲೋ ಅಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಕೆಲವೊಂದು ಮಾಪದಂಡಗಳನ್ನ CPCB ಅವರು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ್ದಾರೆ. ಸೊ ದೇ ಆರ್ ಆಲ್ ಪರ್ಫಾರ್ಮೆನ್ಸ್ ಇಂಡಿಕೇಟರ್ಸ್. ಒನ್ ಇಸ್ ಇನ್ವೆಂಟರಿ ಆಫ್ ಆಲ್ ಹೆಲ್ತ್ ಕೇರ್ ಫೆಸಿಲಿಟೀಸ್ ಅಂಡ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಜನರೇಷನ್ ಆಗಿದೆಯೋ ಇಲ್ಲೋ ಅಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಒಂದು ಇಂಡಿಕೇಟರ್ನ ರೆಡಿ ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ ಅವರು. ಹೆಲ್ತ್ ಕೇರ್ ಫೆಸಿಲಿಟೀಸ್, ಎಷ್ಟು ಹೆಲ್ತ್ ಕೇರ್ ಫೆಸಿಲಿಟೀಸ್ಗೆ ಆಥರೈಸೇಷನ್ ಸಿಕ್ಕಿದೆ ಈ ಒಂದು ಪೊಲ್ಯೂಷನ್ ಕಂಟ್ರೋಲ್ ಬೋರ್ಡ್ ಇಂದ ಅಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆನೂ ನೋಡ್ತಾರೆ. ಕಾಮನ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಫೆಸಿಲಿಟೀಸ್ ಎಷ್ಟಿದೆ ಅಕ್ರಾಸ್ ದ ಸ್ಟೇಟ್, ಅಂಡ್ ಈ ಒಂದು CBWTFs ಎಲ್ಲ ಹೆಲ್ತ್ ಕೇರ್ ಫೆಸಿಲಿಟೀಸ್ನು ಕವರ್ ಮಾಡಕ್ ಆಗ್ತಾ ಇದೆಯೋ ಅಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಇನ್ನೊಂದು ಇಂಡಿಕೇಟರ್ ಇದೆ. ಸ್ಟೇಟ್ ಅಡ್ವೈಸರಿ ಮಾನಿಟರಿಂಗ್ ಕಮಿಟಿ ಸೆಟಪ್ ಮಾಡಿದಾರಾ ಅಂಡ್ ಡಿಸ್ಟ್ರಿಕ್ಟ್ ಲೆವೆಲ್ ಅಲ್ಲಿ ಮಾನಿಟರಿಂಗ್ ಕಮಿಟಿ ಇದೆಯಾ ಅಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಇನ್ನೊಂದು ಇಂಡಿಕೇಟರ್ ಇದೆ. ದೆನ್ ದೇರ್ ಇಸ್ ಅ ಸ್ಟೇಟಸ್ ರಿಗಾರ್ಡಿಂಗ್ ಇಂಪ್ಲಿಮೆಂಟೇಷನ್ ಆಫ್ ಬಾರ್ಕೋಡ್ ಸಿಸ್ಟಮ್. ಸೊ ಈ ಒಂದು ಇಂಪ್ಲಿಮೆಂಟೇಷನ್ ಸ್ಟೇಟಸ್ ಹೇಗಿದೆ ಅಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ದೇರ್ ಇಸ್ ಒನ್ ಇಂಡಿಕೇಟರ್. ಅಂಡ್ ಮಾನಿಟರಿಂಗ್ ಆಫ್ ಹೆಲ್ತ್ ಕೇರ್ ಫೆಸಿಲಿಟೀಸ್ ಅದರ್ ದೆನ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಸಚ್ ಆಸ್ ವೆಟರ್ನರಿ ಹಾಸ್ಪಿಟಲ್ಸ್, ಆನಿಮಲ್ ಹೌಸಸ್, ಆಯುಷ್ ಹಾಸ್ಪಿಟಲ್ಸ್, ಸೊ ಇದ್ರ ಮಾನಿಟರಿಂಗ್ ಎಷ್ಟಾಗ್ತಾ ಇದೆ ಅಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಇನ್ನೊಂದು ಇಂಡಿಕೇಟರ್ ಇದೆ. ಸೊ ದೀಸ್ ಆರ್ ಆಲ್ ಇಂಡಿಕೇಟರ್ಸ್ ವಿಚ್ ಸಿ ಹೌ ಗುಡ್ ಇಸ್ ಹೆಲ್ತ್ ಕೇರ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ being handled and the treatment is being monitored. So idr bagge there are good number of indicators. Then there are some indicators with respect to the infrastructure monitoring of SPCBs, state pollution control boards and pollution control committees. Training and capacity building ಆಗಿದೆಯಾ ಇಲ್ಲಿರೋ officials the training and capacity building ಆಗಿದೆಯಾ ಅಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಇನ್ನೊಂದು ಪರ್ಫಾರ್ಮೆನ್ಸ್ ಇಂಡಿಕೇಟರ್ ಇದೆ. ದೆನ್ ಈ ಒಂದು ಆನ್ಲೈನ್ ಮಾನಿಟರಿಂಗ್ ಸಿಸ್ಟಮ್ ಹಾಕೊಂಡಿದಾರ CBMWTs ಅವರು, ಕಾಮನ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಫೆಸಿಲಿಟೀಸ್ ಅವರು ಅಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ದೇರ್ ಇಸ್ ಒನ್ ಮೋರ್ ಪರ್ಫಾರ್ಮೆನ್ಸ್ ಇಂಡಿಕೇಟರ್, ಆನ್ಯುವಲ್ ಕಂಪ್ಲೈನ್ಸ್ ರಿಪೋರ್ಟ್. ಸೊ ಪ್ರತಿ ಸ್ಟೇಟ್ ಇಂದ ಬೈ ದ ಎಂಡ್ ಆಫ್ ಜುಲೈ ದೇರ್ ನೀಡ್ಸ್ ಟು ಬಿ ಅನ್ ಆನ್ಯುವಲ್ ಕಂಪ್ಲೈನ್ಸ್ ಸ್ಟೇಟಸ್ ರಿಪೋರ್ಟ್ ರಿಗಾರ್ಡಿಂಗ್ ವಾಟ್ ಆರ್ ದ activities and compliances which have been done with respect to biomedical waste. So that's one more performance indicator, and compliance by common facilities and healthcare facilities. So these are all the performance indicators which CPCB has put up, and gaps in these will be used to actually work upon by the pollution control boards and the CPCB. ಸೊ ಈ ಒಂದು ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ ವಿ ಕ್ಯಾನ್ ಫೈಂಡ್ ಗ್ಯಾಪ್ಸ್ ಅಥವಾ ಕುಂದುಕೊರತೆಗಳು ಸ್ಟಾರ್ಟ್ ಫ್ರಾಮ್ ದ ಸೆಗ್ರಿಗೇಷನ್ ಆರ್ ದ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಂಡ್ ಪಾಲಿಸಿ ಲೆವೆಲ್ ಇಂದ ಹಿಡಿದು ಫೈನಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಅಂಡ್ ಡಿಸ್ಪೋಸಲ್ ವರೆಗೂ ವಿ ಕ್ಯಾನ್ ಅಬ್ಸರ್ವ್ ದ ಗ್ಯಾಪ್ಸ್ ಅಂಡ್ ವಿಲ್ ಸಿ ಸಮ್ ಆಫ್ ದೀಸ್ ಗ್ಯಾಪ್ಸ್. ಈ ಒಂದು ಹೆಲ್ತ್ ಕೇರ್ ಫೆಸಿಲಿಟಿ ಅಲ್ಲಿ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಟಿವ್ ಲೆವೆಲ್ ಕೂಡ ನಾಲೆಜ್ ಅಂಡ್ ಆಟಿಟ್ಯೂಡ್ ಇರ್ಬೋದು, ಸಾಕಷ್ಟು ನಾಲೆಜ್ ಇರದೇ ಇರ್ಬೋದು ಈ ಒಂದು ಅಡ್ಮಿನಿಸ್ಟ್ರೇಟರ್ಸ್ಗೆ, ಅಥವಾ ನಾಲೆಜ್ ಇದ್ರೂ ಕೂಡ ಅನ್ಫೇವರೇಬಲ್ ಆಟಿಟ್ಯೂಡ್, ಅಂದ್ರೆ ಅದೊಂದು ಮಾಡುವಂತ ಒಂದು ಎಫಿಷಿಯಂಟ್ಲಿ ಹೆಲ್ತ್ ಕೇರ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅನ್ನು ಇಂಪ್ಲಿಮೆಂಟ್ ಮಾಡುವಂತ ಒಂದು ಆಟಿಟ್ಯೂಡ್ ಇಲ್ಲದೆ ಇರ್ಬೋದು. ನೆಕ್ಸ್ಟ್ ಇಸ್ ಅಮಾಂಗ್ ಹೆಲ್ತ್ ಕೇರ್ ವರ್ಕರ್ಸ್. ಸೊ most of our doctors, most of our administrators do think that it is only the work of the nursing staff or people who are involved in transportation of waste to ensure that efficient waste management happens. No, that is not the case, because this is not with everyone I'm telling, but there are good number of people who think so. But if we have that particular attitude, then there is no proper segregation which happens, and thereby the whole purpose of the segregation at source becomes futile. So now even segregation at source anna efficiently ಮಾಡಿದ್ರೆ ಮುಂದಿನ ಎಲ್ಲ ಹಂತಗಳು ನೀಟಾಗಿ ನಡ್ಕೊಂಡು ಹೋಗುತ್ತೆ ಹೆಲ್ತ್ ಕೇರ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಲ್ಲಿ. ನಾವು ಸ್ಟಾರ್ಟಿಂಗ್ ಅಲ್ಲಿ ಸೆಗ್ರಿಗೇಟ್ ಮಾಡೋ ಟೈಮಿಗೆ ನಾವು ಯೆಲ್ಲೋ ಬಿನ್ ಇಂದ ತೆಗೆದ್ಬಿಟ್ಟು ರೆಡ್ ಬಿನ್ನಿಗೆ ಹಾಕ್ತಾ ಇದೀವಿ, ಬ್ಲೂ ಬಿನ್ನಿಗೆ ಹಾಕ್ತಾ ಇದೀವಿ, ಅಥವಾ ಬ್ಲಾಕಿಗೆ ಹಾಕ್ತಾ ಇದೀವಿ ಅಂತಂದ್ರೆ ಡೆಫಿನೆಟ್ಲಿ ದ ಹೋಲ್ ಪರ್ಪಸ್ ಆಫ್ ದಿಸ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ವುಡ್ not be going in the right direction. So that is the knowledge and attitude gap at the healthcare facilities. And when the healthcare facilities across Karnataka were reviewed in one of the projects, there were gaps identified in not existence of biomedical waste committees. ಕೆಲವೊಂದು ಕಡೆ written SOPs ಇರಲಿಲ್ಲ. There was no designated temporary storage room for biomedical waste. Workers were not supplied with PPE. There was no waste management register. There was no injury register. There was no spill register. And you can see absence of spill register was quite surprising, and it was not to be found in more than almost 50% of the large and the small hospitals. So even though biomedical waste management rules 2016 ನೋಡಿದಾಗ these are all the macro areas which are important and which need to be managed well. And this slide says about what was the segregation efficiency. So medium sized hospitals ali it was okay, but not good in some of the large and the small hospitals. Another study from Karnataka says that only 28% of the hospitals segregate the biomedical waste properly. Andre only 3 in 10 hospitals have got a efficient segregation of biomedical waste. Whereas if we see as per the regional guidelines, it was the biomedical waste management was the treatment of biomedical waste was happening only in 40% of the hospitals. And we have a long way to go when it comes to addressing these two gaps. One is segregation, next is treatment. So the first step as well as the last step, both places we are faltering and we are lagging behind. So some commonly observed violations now nodiro prakara, we can see that there was mixing of biomedical waste with general waste, mismatch in the color coded liners and containers. So black bag ittu antare adike black container irbekagate, yellow bag ittu antare it should have a yellow container. So there should not be any mismatch in this. So right side figure alli ನೀವು ನೋಡ್ತಾ ಇದ್ದೀರಾ, there are gray colored or ಬೂದು ಬಣ್ಣದ container ಗಳಿದೆ, but we can see that there are the liners black, yellow and red which are there inside that. So such things should not happen. Now most of the hospitals as well as the private, in both private and government sector, they have been procuring these color coded as well as containers as per the guideline, and that should be maintained. Poor segregation, so you can see that the cardboard waste which should go for the black bag, the plastic waste which should go to red, and also the other things which should not have been over here in the yellow bag are directly coming into the yellow bag, and this is an example of poor segregation. So segregation at source ಬಗ್ಗೆ ನಾವು ಹೇಳಬೇಕಾದ್ರೆ, this is the one picture which we can show to our people that such a thing should not happen. ಸೊ ಇದೊಂದು ಕಾಮನ್ ಸೈಡ್, ಡ್ರೆಸ್ಸಿಂಗ್ ಟ್ರಾಲಿಗೆ ಸೈಡಿಗೆ ಎಕ್ಸ್ಟೆನ್ಷನ್ ಹುಕ್ ಇದ್ದಲ್ಲಿ ನಾವೇನ್ ಮಾಡ್ತೀವಿ ಅಂತಂದ್ರೆ ಯೆಲ್ಲೋ ಮತ್ತೆ ರೆಡ್ ಬ್ಯಾಗ್ ಅನ್ನ ಅಥವಾ ಇನ್ನೊಂದು ಯಾವುದೋ ಬ್ಯಾಗ್ ಅನ್ನ ಲೈನರ್ ಅನ್ನ ಹಾಕೊಂಡು ಅದನ್ನ ಯೂಸ್ ಮಾಡ್ತಾ ಇರ್ತೀವಿ, ವಿಚ್ ಇಸ್ ನಾಟ್ ರೈಟ್ ಆಕ್ಚುಲಿ, ಬಿಕಾಸ್ ಯು ಟೆಂಡ್ ಟು ಕಂಟಾಮಿನೇಟ್ ದ ಅದರ್ ಥಿಂಗ್ಸ್ ಇನ್ ದಟ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಟ್ರಾಲಿ ಆಲ್ಸೋ. ಸೊ ಪ್ಲೀಸ್ ಡೋಂಟ್ ಯೂಸ್ ದಿಸ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಮೆಥಡ್ ಆಫ್ segregation whenever the waste is generated. ಸೊ ಆ ವಾರ್ಡ್ ಅಲ್ಲಿ ಅಥವಾ ಆ ಏರಿಯಾದಲ್ಲಿ ಇರೋ ಬಿನ್ಸಿಗೆ ಹೋಗಿ ಅದನ್ನ ಹಾಕ್ಬೇಕಾಗತ್ತೆ. ಇಂಪ್ರಾಪರ್ ಟ್ರಾನ್ಸ್ಪೋರ್ಟೇಷನ್ ಆಫ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್. ಸೊ ನಾವು ಹೇಳ್ತೀವಿ ಕ್ಲೋಸ್ಡ್ ಕಂಟೈನರ್ಸ್ ಬೇಕು, ಆಲ್ವೇಸ್ ದೇರ್ ಶುಡ್ ಬಿ ಅ ಲಿಡ್ ವಿಚ್ ಶುಡ್ ಬಿ closed, and then the biomedical waste need to be transported in wheeled trolleys. Yes, trolleys ಗೆ wheels ಇದೆ, agreed, but left side ಇರೋ ಪಿಕ್ಚರ್ ಅಲ್ಲಿ ನೀವು ನೋಡ್ತಾ ಇದ್ದೀರಾ, the waste is overflowing that particular trolley and thereby you cannot close the lid. Right side ಅಲ್ಲಿ ಏನಿದೆ ಅಂದ್ರೆ there is no much of waste but there is no lid to that, and you can notice that that particular healthcare worker is not having adequate or appropriate personal protective equipment. At least ಅವ್ರಿಗೆ ಒಂದು ಗಮ್ ಬೂಟ್ಸು ಅಂಡ್ ಹೆವಿ ಡ್ಯೂಟಿ ರೆಡ್ ರಬ್ಬರ್ ಗ್ಲೌಸ್ ಅಂಡ್ ಮಾಸ್ಕ್ ಅಂಡ್ ಕ್ಯಾಪ್ which are very important or basic personal protective equipment ಅನ್ನ ಪ್ರೊವೈಡ್ ಮಾಡಲೇಬೇಕು. So these are common sites which we see across hospitals, and again what is supposed to be done is put up in the right side of the picture. ನಾವು ಟೆಂಪರರಿ ಸ್ಟೋರೇಜ್ ಬಗ್ಗೆ ಹೇಳ್ತೀವಿ, ಹೆಚ್ಚಾಗಿ ಒಂದು 24 to 48 hours sometimes we have to store this biomedical waste in a safe secure place. So Ramkrishna Gaud sir ಹಾಕಿರೋ ಪ್ರಕಾರ ಒಂದು ಪಿಕ್ಚರ್ ಹಾಕಿದ್ರು where it was a closed room, very well ventilated, secured under lock and key. ಇಲ್ಲಿ ನೀವು ನೋಡ್ತಾ ಇದ್ದೀರಾ, there is an animal dog also roaming around in this particular place which is the designated place for storage of biomedical waste. But ಸ್ಟೋರ್ ಆಗಿರೋದಕ್ಕಿಂತ ಜಾಸ್ತಿ ನೆಲದ ಮೇಲೆ ಬಿದ್ದಿರೋ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಜಾಸ್ತಿ ಇದೆ ಇಲ್ಲಿ. ಸೊ ಇಫ್ ದಿಸ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಪ್ಲೇಸ್ ಇಸ್ ನಾಟ್ ಕವರ್ಡ್, ಇಫ್ ದೇರ್ ಇಸ್ ನೋ ರೂಫಿಂಗ್, ಸೊ ಆವಾಗ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಮಳೆ ಬಂದಾಗ ಈ ಹೆಲ್ತ್ ಕೇರ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ತೊಳ್ಕೊಂಡು ಹೋಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ, ಫ್ಲಡ್ಡಿಂಗ್ ಆಗೋ ಚಾನ್ಸ್ ಇರುತ್ತೆ. ಸೊ ದಿಸ್ ಇಸ್ ಒನ್ ಥಿಂಗ್ ವಿಚ್ ಶುಡ್ ಬಿ ಅವಾಯ್ಡೆಡ್. ಇಟ್ ಶುಡ್ ಬಿ ಕೆಪ್ಟ್ ಇನ್ ಸೆಕ್ಯೂರ್ place, well ventilated place, and in the color coded bags which they are supposed to be. So gates or even enclosures with safe lock and key ಹಾಕಿರೋದ್ರಿಂದ ಏನಂದ್ರೆ ಅನಿಮಲ್ಸ್ಗೂ ಕೂಡ ಯಾವುದೇ ಪ್ರಾಣಿಗಳಿಗೆ ಇದಕ್ಕೊಂದು ಆಕ್ಸೆಸ್ ಇರೋದಿಲ್ಲ. If it is a non-bedded high healthcare facility or healthcare facilities with low quantity of waste generation, for example, it can be primary health centers or it can be PHUs, primary health units, or even single operated doctor's clinic. So ee tara iddaga, if the quantity of waste is very low, then some plastic containers can be used for temporary storage with well ventilated lid and lock and key facility. So that is one thing which can be used for temporary storage. So another gap is that handing over biomedical waste to unauthorized waste handlers. So namdo state pollution control board and the district level offices of KSPCB have a list of waste handlers who can be handed over these particular wastes, especially when it comes to recyclable waste or metal sharps. So ee tara waste handlers na bittu now unauthorized dealers ge now adana kotre, there is a chance that these particular recyclable waste, especially syringes, can come back to the hospital, can come back to the market, if not in your place, at some other place. So ee one practice anna now, if some people are following, then this is the one which should be stopped, and the list of authorized waste handlers is there with the district offices of KSPCB. So please get in touch with them and get the list of the authorized waste handlers. Open burning of any waste, especially when it is chlorinated waste, will emit dioxins and furans. So please don't go for open burning of any sort of waste, including the healthcare waste. Then when you are not properly disposing the healthcare waste, and when it is mixed with general waste, there is always a possibility that animals can feed on it. So this is another hazard wherein the animals also can get affected in the process. So when it comes to implementation, CPCB report 2021 May says that almost all the states, with the exception of Andhra Pradesh, Arunachal Pradesh, Sikkim and West Bengal, have organized training and awareness initiative. So one such initiative is currently going on, what we are doing it to the districts. So ಇಷ್ಟುವರೆಗೆ ನಾವು ಫೆಸಿಲಿಟೀಸ್ ಅಥವಾ ಹೆಲ್ತ್ ಕೇರ್ ಫೆಸಿಲಿಟೀಸ್ ಅಲ್ಲಿ ಕೆಲವೊಂದು ಗ್ಯಾಪ್ಸ್ ಅನ್ನು ನೋಡಿದ್ವಿ. We can see some of the gaps in the treatment facilities, common biomedical waste treatment facilities. When it comes to implementation, ಎಲ್ಲ 24 biomedical waste treatment facilities in Karnataka have started using online monitoring systems for their effluent output. Then barcoding for tracking of healthcare waste is implemented, but it is in the process of full implementation. It's not yet reached the level of full implementation. So that is in the process. Compliance with standards. ನಾವೇನು ಹೇಳ್ತೀವಿ ಅಂದ್ರೆ, ವೆನ್ಸ್ there is incineration which needs to be done at 1200 degrees, but ಇಲ್ಲಿ ನೋಡ್ತಾ ಇದ್ದೀರಾ almost it is less than that, it is half of that, almost 662 degrees, which is suboptimal temperature. So ಆ ತರ incineration ಮಾಡಿದಾಗ you can see that the leftover will be black incineration ash. That means there can be some amount of waste which is not actually completely incinerated. So this is one thing which you need to actually look into when if there are some CBWTFs as a part of this one. So this is meant mainly for them, because it should reach the optimum temperature. And once there is incineration of unsegregated waste, then also you can expect that whatever should have been there as a part of incineration, if something else comes up over there, there can be emission of dioxins and furans, but especially when plastic waste is being burned, chlorinated plastic waste. So these are the things which the common biomedical waste treatment facilities also should comply and see to it that they are sticking on to the standards. Coming to regulatory mechanisms, monitoring of small and large healthcare facilities is not actually up to the mark, and there is issue with managing household biomedical waste. So this is taking bigger importance now because of using self-testing kits for COVID-19. So people are using self-testing kits at home and then disposing it off along with the solid waste. And yes, since it is hazardous, it shouldn't be discarded along with the recyclable solid waste. It should be handed over to the waste pickers or the sanitary workers who come for house to house collection of solid waste separately. So another study from Karnataka says that regular monitoring of healthcare facilities and CBMWTFs are not actually in place. We are not submitting the annual reports within deadline. Barcoding systems are not fully implemented. The CBMWTFs, common biomedical waste treatment facilities, are not upgraded with the new emission rules, and authorization, as far as authorization of the healthcare facilities are concerned, they are not actually up to the mark. That means the authorization is not fully happening. There are some solutions which can be looked into. One is decentralized monitoring. Another, it should be made at the district level. So district level committees should be formed for monitoring of the healthcare waste scenario. As our professor from microbiology told, that there are things which are happening at the medical college level also, but more people should be brought in so that they are also involved in monitoring. So that is one thing which need to happen. Training and retraining. So now train kuda, there are some queries, there are some gaps, there are some issues which are persistent. So training and retraining, because healthcare waste management problem is an attitudinal problem. It is not that people don't have knowledge. Many have knowledge, but our attitude is not favorable. It tends to be negative when it comes to segregation and further management. Third party audits, andre governmental adre yaro private or players athwa private institutions na karadbiಟ್ಟು athwa yaro NGO setup ಅಲ್ಲಿ work ಮಾಡ್ತಾ ಇರೋರನ್ನ ಕರೆದ್ಬಿಟ್ಟು ಅಥವಾ ಹೆಲ್ತ್ ವೇಸ್ಟ್ ಅಲ್ಲಿ ಪರಿಣಿತರನ್ನ ಕರೆದು ಹೊರಗಡೆಯಿಂದ ಆಡಿಟ್ಸ್ ಮಾಡಕ್ಕೆ ಒಂದು ಅವಕಾಶ ಮಾಡಿಕೊಡ್ಬೇಕು ಅವರಿಗೆ, so that we will be able to find what are the gaps, what are the issues, and thereby those things can be addressed. ಯಾವಾಗೂ ಹೇಳ್ತೀವಿ ನಾವು ಶಂಕದಲ್ಲಿ ಬಂದ್ರೆ ತೀರ್ಥ ಅಂತೇಳಿ. So similarly, if people from outside are coming and then they are doing audits and then telling us that these are the things which you need to improve, there can be more accountability on the part of that particular institution, the institutional head, administrators, in ensuring that healthcare waste management is happening as per the guideline. Then we need to have better accountability of stakeholders, right from healthcare facility level, CBWTF level, and also regulatory authorities. Then budgeting for healthcare facilities. So in our PIPs, annual PIPs, we need to include this budget for efficient management of healthcare waste. So it can be for the bins, it can be for the liners, or it can be for the MOUs with the CBWTFs for their regular routine collection of healthcare waste. So idikkelladakku we should ensure that there is an annual budget. Proper implementation of barcoding system, so that everyone, the CBWTFs will be able to track which is the source of the waste upon its reach. Improve and create stakeholder awareness to impose source segregation. All waste generators and processors should be registered by the regulatory authorities on COVID-19 biomedical waste application. installation and monitoring of OCEMS at CBMWTS, extensive training and awareness programs for healthcare workers and state pollution control board officials, stringent methods to impose environmental compensation charge. ಅಂದ್ರೆ ಈಗ ನಾವು ಒಂದು ತಪ್ಪು ಮಾಡಿದೀವಿ ಇಲ್ಲಿ, we are not able to dispose it of, the hospitals ಅವರು ಎಲ್ಲೋ ಹೋಗ್ಬಿಟ್ಟು ಡಿಸ್ಪೋಸ್ ಮಾಡಿಬಿಟ್ಟಿದ್ದಾರೆ. ಸೊ ಅಂತ ಒಂದು ಟೈಮಲ್ಲಿ ಇಫ್ ದ compensation charge for polluting the environment is strictly imposed, or there have been some punishments over these particular healthcare facilities or the administrators or the managements, so then it would go a long way, because such things will not be repeated, especially by the regular offender. So once after 1 or 2 warnings, so maybe strict ECC will help us in sticking on to the efficient or good biomedical waste management. So these are my references. So we can, the session is open for discussion now. If there are any questions, I can take it up. Yeah, I can see some things in the chat box. Sir, Ramkrishna sir, can we take these questions at the end, or should we take it now?
Akshay.
Yes.
Hello.
Yes, sir. I'm there.
Akshay, there's a call Pooja and Narasimha should take, Akshay.
Yes, Pooja.
Yes, sir.
Because Narasimha also will end up waiting for long time.
Okay, sir. Last
Yes.
till ತಗೊಳ್ಳೋಣ sir ಈಗ.
Last time ತಗೊಳ್ಳೋಣ.
Okay, fine.
Okay, sir.
Fine, we'll
Yeah,
take all the
but-
questions at the end.
But all the participants, please put your questions in the chat box.
Yes. We'll take
And
up all the
Pooja,
questions at
have
the
you
end.
put the email in the chat box, Pooja? Email ಕೊಟ್ಬಿಡಿ, email ಕೊಟ್ಬಿಡಿ chat box ಅಲ್ಲಿ.
Okay, sir. Share ಮಾಡ್ತೀವಿ.
Okay. I think Narasimha can do his session now.
ಜೈವಿಕ ವೈದ್ಯಕೀಯ ತ್ಯಾಜ್ಯ ನಿರ್ವಹಣೆಯಲ್ಲಿ ಉಂಟಾಗುತ್ತಿರುವ ಕುಂದುಕೊರತೆಗಳ ಬಗ್ಗೆ ವಿವರಿಸಿದ ಡಾಕ್ಟರ್ ಅಕ್ಷಯ್ ರವರಿಗೆ ಧನ್ಯವಾದಗಳು. ಇದೀಗ ಕೋವಿಡ್ ತ್ಯಾಜ್ಯ ನಿರ್ವಹಣೆ ಕುರಿತು ವಿವರಿಸಲಿದ್ದಾರೆ ಡಾಕ್ಟರ್ ನರಸಿಂಹ ಬಿಸಿ ರವರು. ಸರ್, ಓವರ್ ಟು ಯು ಸರ್.
ನಮಸ್ಕಾರ ಸರ್, ಕೇಳಿಸ್ತಿದ್ಯಾ ಸರ್?
ಹಾ ಸರ್, ಕೇಳಿಸ್ತಿದೆ.
PPT ಕಾಣಿಸ್ತಿದ್ಯಾ ಸರ್?
ಸರ್, ಸ್ಲೈಡ್ ಶೋ ಕೊಡಿ.
ಕೊಟ್ಟಿದೆ ಸರ್.
ಹಾ ಸರ್, ಸ್ಲೈಡ್ ಶೋ ಆಗಿದೆ. ಸ್ಲೈಡ್ಸ್ ಮೂವ್ ಮಾಡಿ ಸರ್.
ಹೋಗ್ತಿದ್ಯಾ ಸರ್?
ಹಾ ಸರ್.
ಓಕೆ,
Continue, sir.
ಥ್ಯಾಂಕ್ ಯು.
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಗುಡ್ ಈವ್ನಿಂಗ್, ಗುಡ್ ಆಫ್ಟರ್ನೂನ್ ಅಂಡ್ ನಮಸ್ಕಾರ ಎಲ್ಲರಿಗೂ. ಸೊ ನಾವು ಇತ್ತೀಚಿನ 2020-21 ವರ್ಷದಿಂದ ನಾವು ಕೋವಿಡ್ ಸಮಸ್ಯೆಯಿಂದ ಎಲ್ಲ ಏರಿಯಾಸ್ ಅನ್ನು ಅಫೆಕ್ಟ್ ಮಾಡಿದೆ. ಓಕೆ, ಅದೇ ರೀತಿ ನಮ್ಮ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಸಹ ಸ್ವಲ್ಪ ವ್ಯತ್ಯಾಸಗಳನ್ನ ನಮಗೆ ತಂದುಕೊಟ್ಟಿದೆ COVID-19 ಇನ್ಫೆಕ್ಷನ್. ಸೊ ಅದೇ ರೀತಿ ಆಲ್ರೆಡಿ ಜನರಲ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಬಗ್ಗೆ ಮತ್ತೆ ಗ್ಯಾಪ್ ಅನಾಲಿಸಿಸ್ ಮಾಡಿ ಅದಕ್ಕೆ ಏನು ಸೊಲ್ಯೂಷನ್ಸ್ ಇದೆ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಡಾಕ್ಟರ್ ರಾಮಕೃಷ್ಣ ಗೌಡ ಸರ್ ಅಂಡ್ ಡಾಕ್ಟರ್ ಅಕ್ಷಯ್ ಸರ್ has intensively explained about biomedical waste management. So this session purely on COVID-19 biomedical waste management. So ಯಾಕೆ ನಾವು COVID-19 biomedical waste management ಬಗ್ಗೆ ಇಷ್ಟು ಫೋಕಸ್ ಮಾಡಬೇಕು, ಇಷ್ಟು ಇಂಪಾರ್ಟೆನ್ಸ್ ಕೊಡಬೇಕು ಅಂತಂದ್ರೆ, ಸೊ ಬಿಫೋರ್ ಕೋವಿಡ್ ಅಂಡ್ ಆಫ್ಟರ್ ಕೋವಿಡ್ ಅಂತ ನೋಡ್ಕೊಂಡ್ರೆ ದ ಅಮೌಂಟ್ ಆಫ್ ವೇಸ್ಟ್ ಜನರೇಷನ್ has gone around more than 6 times compared to pre-COVID era. Okay, ಅದೇ ರೀತಿ ನಾವು ಈ ಚಾರ್ಟ್ ಅನ್ನು ನೋಡಿದ್ರೆ, ಸೊ ಆಸ್ ದ ಕೇಸಸ್ ಇನ್ಕ್ರೀಸ್, ಓಕೆ, ಮಂತ್ ವೈಸ್ ನೋಡ್ಕೊಳ್ಳಿ, ಆಸ್ ಕೇಸಸ್ ಇನ್ಕ್ರೀಸ್ ಆದ ಅಷ್ಟು ದ ಕ್ವಾಂಟಮ್ ಆಫ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಜನರೇಟೆಡ್ ಬಿಕಾಸ್ ಆಫ್ COVID-19 management with respect to diagnosis, treatment, vaccination, so all include it has increased with respect to the number of COVID cases when we see month-wise. When we see the state-wise also, the amount of, so blue color is in the 2020 first wave, and the orange color or red color, it is in the May 2021 in the second wave. See the difference, the quantum. And especially in the first wave, what was happened was, so without much of clear knowledge about the biomedical waste management, thinking that all the waste generated in the COVID wards, ICU, okay, even home quarantine, including waste food, okay, all the general waste was mixed. Thinking that it also got infected, okay, it was also considered as a infectious waste, and the amount of COVID biomedical waste generated in the first wave was higher compared to second wave, because in the second wave we had a clear cut knowledge and guidelines with respect to management of biomedical waste with respect to COVID-19. Okay. So this graph also suggests, it shows the quantum of waste generated is directly proportional to the number of cases. So ಮತ್ತೆ ಯಾಕೆ ಈ ರೀತಿ ನಮ್ಮ ಕೋವಿಡ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಲ್ಲಿ ಕ್ರೈಸಿಸ್ ಬಂತು ಅಂತಂದ್ರೆ, ಇನಿಷಿಯಲಿ ಸೊ ಈವನ್ ಇನ್ ಕರ್ನಾಟಕ 1 or 2 cases ಬಂದ ತಕ್ಷಣ ಎವ್ರಿಬಡಿ used to have PPE kit from top to bottom, head ಇಂದ ಹಿಡಿದು foot cover ವರೆಗೂ all were using PPE kit irrespective of the risk area. There is a risk criteria: moderate risk, low risk, moderated, severe risk areas, critical areas. So with the irrespective of that criticality, we started using PPE kit, okay, because without any clear knowledge about the modes of transmission and all the aspects, okay, there was a huge gap in the knowledge in understanding the COVID-19. That's why we started using large quantum of biomedical waste management. So this include, along with the lack of knowledge about segregation and impact of this waste on the environment, so there was a huge quantum generated, and management was a very huge task, difficult task it was. And also at the community level, okay, everybody started using mask. Even home isolation, people started using PPE, caregivers started using PPE in some places without any knowledge. So all this brought us the crisis in the biomedical waste management in the COVID era. Okay. So in this background, so this biomedical waste management rule has given a definition of what is COVID-19 biomedical waste. So it is similar to the general biomedical waste. Okay, the biomedical waste generated during diagnosis, treatment of COVID-19 suspected as well as confirmed patients, including in isolation wards, quarantine centers, sample collection centers, RT-PCR laboratories, okay, and immunization, vaccination of COVID-19. All this, the waste which is generated in all the different ways, so it was considered as a COVID biomedical waste. Sources, main sources are at the time of diagnosis, either in RT-PCR or in RAT, and waste generated from COVID wards, whether it is a isolation ward or ICU, okay, quarantine centers, and as well as immunization of COVID-19. These are the sources of COVID-19. Why we need to concern about COVID-19? Is there any difference between COVID-19 waste and general biomedical waste management? Yes, definitely. To differentiate the biomedical waste management, okay, some guidelines are brought by our pollution control board. So if we don't manage properly, okay, it will have a huge bad impact on the environment as well as the health of the human beings. So we have to manage the biomedical waste similar to the other biomedical waste management life cycle approach, which we are going to learn in next slides. So so many revisions have brought by the Pollution Control Board with respect to COVID-19 biomedical waste management. The recent one was 21st July 2020, and along with that, biomedical waste management rule 2016 and amendments in 2018 and 19. So what is this life cycle approach? Life cycle approach means from point of waste generation to the final disposal. Okay, what all happens in between, that is point segregation at the point of generation, and within the institutions intramural transportation in a closed trolley, and secured storage outside the hospital for temporary storage, and transportation to common biomedical waste treatment facility through the closed trolleys and separate vehicle, and final treatment at CBWTF and final disposal. So up to the waste generation to the secured storage, it is within the hospital, and from the transportation to CBWTF to final disposal, it happens in a CBWTF. So this is what life cycle approach. So all the points we have to be very careful in throughout the life cycle. Otherwise, if we make any mistakes in this life cycle, again there is the purpose what we are managing the biomedical waste will not serve the purpose. Okay, that's what we have to understand from life cycle approach. And so what is the difference between general biomedical waste management and COVID-19 biomedical waste management? It is almost same, only few changes are there. Okay, same color categories: yellow, blue, red, and white. So yellow, all the anatomical, human anatomical waste, animal anatomical waste, soiled waste, expired drugs and discarded medicine, chemical waste, microbiology and laboratory waste, blood bags, discarded linen, all the personal protective equipments except gloves. So in this personal protection equipments, we have to see the we have to give importance to some points. If the PPE used is non-plastic or semi-plastic one, then we have to dispose into the yellow bin, which is double line cover should be put. If the PPE used is plastic one, then it has to be disposed into the double liner container red bin. Okay, and also shield, okay, and goggles, face shield, and waterproof apron, all these should come into the red color container. Otherwise it is same. Okay, clear, yellow and red. And when it comes to red color, it is all the recyclable plastics and gloves and goggles, face shield, because which is made of plastic, and also if the PPE is plastic one, and the plastic apron, all should come into the red bin. So blue color, it is broken or discarded contaminated glassware and metallic body implants. Again, it is in white, it is metallic sharps and auto disposable syringes. This is what difference with respect to color coding. Is it clear? Okay, and some highlights with respect to COVID-19 biomedical waste management. So separate labeled color coded bins in isolation wards or ICUs. There should be a separate color labeled COVID-19 labeling should be there on a bin. Color coded bins in isolation ward as well as ICU. It should be foot operated, and the cover liners. So general waste we use only single cover, but whereas for COVID-19 biomedical waste we have to use double layered color coded non-chlorinated bags to ensure adequate strength and leak proof. And there should be a dedicated closed trolley for the COVID-19 biomedical waste transportation from wards to the storage room. The containers as well as bins should be cleaned with 1% hypochlorite solution. So after usage, outside as well as inside should be disinfected with the 1% sodium hypochlorite solution. So if possible, there should be a separate storage, temporary storage outside the hospital for biomedical waste, COVID-19 biomedical waste. And if possible, they can bring the waste generated in the isolation wards and COVID-19 ICUs directly to the common biomedical waste treatment facility vehicle, if wherever is possible. And the bins should be labeled with COVID-19, bags and trolleys as COVID. All the label bins, bags and trolleys should be labeled as COVID-19. Why? Because the priority, if we don't label, so we cannot differentiate between COVID-19 and general biomedical waste. So if we label it as COVID-19 biomedical waste, treatment at treatment facility, they first do the process, whether it is incineration or autoclaving, whatever they want, they give a first priority to the COVID-19 biomedical waste. So we have to maintain a separate record. So full PPE should be provided to the sanitation staff who are waste handlers. And there should be a dedicated staff for the COVID-19 biomedical waste and solid waste. Okay, solid waste should be managed by some other persons, and COVID biomedical waste should be managed by a dedicated staff. We should not ask them to do the both. And it is a golden rule, segregation at the point of generation. So all the COVID-19 biomedical waste handlers should be trained with respect to COVID-19 biomedical waste management rules and regulations. Every updates comes, we have to train them. So general solid waste segregation, it is similar to the other rules as per solid waste management rules 2016, should be collected in wet and dry waste. And the point we have to emphasize is we should spray 1% sodium hypochlorite solution to the segregated general solid waste before hand over it to the urban local body or municipality. Okay, whoever comes to collection of general waste, we have to spray 1% of sodium hypochlorite solution on that covers and then hand over. We have to minimize as much as possible disposable items. Disposable items like plastic plates, plastic drinking glasses, okay, any other disposable bedspreads like that, as we have to minimize as much as possible. So don'ts with respect to COVID-19 biomedical waste, it also applies to other waste. So we should not mix general waste and COVID-19 biomedical waste. As Ramakrishna Gowda sir was saying in this presentation, only 15% is infectious waste, okay, and another 85% is non-infectious waste. If we mix, then it will become a 100% infectious waste. So same dictum applies here also. We should never mix the both general waste as well as COVID-19 biomedical waste. And do not disinfect yellow bag with sodium hypochlorite solution, because yellow bag will go to incineration. If we spray with the sodium hypochlorite, so the toxic chemicals will be released into the environment. Do not hand over COVID-19 biomedical waste without proper label to common biomedical waste treatment facilities. As I said, so if we don't label, they cannot differentiate. So they cannot give priority to the COVID-19 biomedical waste. So we should not transport COVID-19 biomedical waste in a open trolleys. It has to be transported in a closed trolleys. Okay, in diagram says all the bins should be labeled as COVID-19. Even the liner should be labeled as COVID-19. Even trolley should be labeled as COVID-19. These are the differences Okay, and use of PPE, as already I was saying in previous slides. So there is a demarcation between the low risk area, moderate risk area, high risk area. If you don't follow this, so we will be unnecessarily generating large quantum of yellow waste, which cost more for each kg of biomedical waste because it goes to incineration. So if you use in low risk area like help desk, so only triple layer mask and gloves is enough. In moderate risk areas, N95 mask and gloves. Moderate risk areas, for example, laundry and CSST. And high risk area only we have to use complete full of PPE, that is lab and critical areas, lab and ICU and COVID isolation wards. So this is how prioritization should be given for PPE with respect to the risk of the area. So what we have learned from a COVID-19 biomedical waste management after COVID-19 is it has underlined about importance of biomedical waste management even to the up to the peripheral level, very low, most peripheral region. It has taught us the importance of biomedical waste management. So, however, we have gained so much of importance and we are doing so much correctly. It has to be strengthened because new people will be adding. Okay, the guidelines keep updating, so we have to keep training and should be strengthened. So attitudes has changed to some extent, at least. So much of attitudes has changed among healthcare workers as well as common public after COVID. Before COVID, so whenever we used to teach them WHO 6 steps of hand washing, they used to think these people are jobless. Okay, they have come to teach us hand washing. But after COVID, people are started following the hand washing techniques. So we have definitions and clear definitions of COVID-19. The core principles of 3 R's: reduce, reuse, recycle. Okay, we have to reduce disposable items, so we can reuse the reuse and recycle the waste generated. Okay, and we need to augment the capacity of the common biomedical waste treatment facilities. That of course that will be always a challenge. And we have learned so much from COVID-19 about biomedical waste management to follow CPCB guidelines. For once in a very frequent updates we got, and we started training and retraining the healthcare workers as well as waste handlers. We started following and we treated coronavirus as any infectious waste and segregation at source. Okay, that is always there, and we give much importance to that. Dispose in an infectious waste in a foot operated bins with a suitable color coded lines. Proper handling, collection, transport, storage, use of PPE and hand washing techniques, use of safe and environmentally sound treatment methods, centralized treatment facility using autoclave, microwave, hybrid stream system, microwave, eco-friendly treatment methods, disfigurement of used masks or PPEs. So if we don't disfigure, so unauthorized waste handlers will take and they autoclave or sterilize it and repack and sell it to the institutes. That's why disfigurement of mask is PPE is very important. We started following routine disinfection cleaning protocols for waste bins. So need of hour, we need to follow life cycle approach very properly. So out of so many steps in life cycle approach, anywhere if we don't follow that single life cycle approach, the entire process, the purpose what we are doing will not serve. So startups for better alternative extended producer responsibility, like for example expired drugs. Okay, so it is the producer responsibility to collect sometimes the expired drugs. So that extended responsibility should be given importance. Startups for better alternative waste management solutions and recyclings should be need of an hour, identifying the infrastructure gaps and leveraging the technology. So already the gap identification session, it was told beautifully, and whatever possible solutions sir has given, awareness among healthcare workers and occupational safety. Of course, it is biomedical waste management is a occupational safety concern also. So awareness among the newly recruited waste handlers, as well as reinforcement to the existing one, and any updates in the guidelines should be given importance. So as Dr. Prithvi sir was saying, biomedical waste management, occupational safety, environmental safety issue, patient safety issue, it is an attitudinal issue. So CPCB has developed very beautiful videos on biomedical waste management with respect to introduction, segregation, collection, transportation, occupational safety, on-site pre-treatment, blood spill management, mercury spill management, and summary both in Kannada and English. So slides will be shared with you. So this, once you click the this link, so we will be directed to the videos. And one more beautiful video on COVID-19 biomedical waste management. If you click that, there is a very good video to understand what is the importance of COVID-19 biomedical waste management and how the process is. Okay, so these are the references, and sincere thanks to Dr. Lalita ma'am and Somna ma'am and Akshaya sir for giving these resources. And thank you, Ampri, for giving an opportunity, and thanks to all the Gulbarga participants, including from officers, all the healthcare workers, all the departments, whoever is here. Okay, thank you for patient listening. Thank you.
Thank you, sir.
Thank you,
That was a need for our presentation. Now let us move on to our next presentation, a small presentation by Mr. Manoj Kumar, who works as a technology lead in Knowledge Lens. His team has developed an app on COVID-19 biomedical waste management, and he will be briefing about that app and how to use that app. He will be briefing on that. I welcome Mr. Manoj Kumar.
Thanks, Pooja, for your warm welcome. So let me know once you are able to see the screen.
It is visible, sir. Slide. It is visible.
Are you able to see my screen?
Yes, yes.
Okay. So, good afternoon. Idea of this traction is to make sure that you people will be handy on usage of this application. So, I'll just brief you about this application. So, this application has designed long back in 2020 as per the NCT order. So, where we have to monitor the surface of the COVID-19 biomedical waste, which is being speculating in across the country. So, we have designed this. So, when we come to the application, say the app will consist of steps which are being displayed on it. So the first step will start from the registration. So here registration is meant only for the hospitals, the generators. So rest of the stakeholders involved like transporters, waste handlers or something else. So they will not be a part of this registration process. However, only the hospitals are requested to register in the application. Is there any issue or?
Nothing. It's you can continue, Manoj.
Okay.
It's just a problem.
Once the registration is done, so when hospital has to go to the Play Store and they have to download the application. Once they download the application, they have to put it like having like just click on the registration page. They'll be getting the details like enter your name, enter your CPW details, all those stuff will be coming. So it's a simple registration, nothing bigger in it. So once the registration is successfully done, later on, you will be receiving an username password on the registered email ID only. Using this registered email ID, what you have to do is you have to enter the application and start filling it. Okay, I'll explain the details. So then registration is done. Now waste tracking. So waste tracking is involved in 3 levels. Like the app application is being tracked at generator level, waste handler level, transporter level, then CPWTF level. Then finally, once the data is everything is coming, so only the final step is involved with so the data has to be verified by CPWTF as well as SPCS. So I will take you to this. So here, this is an generator screen, which means hospital screen, how it looks. The moment you enter using the username of hospital, you will be landing up into the screen. What you have to do is you have to just put it on a, this one, handover waste, just click on it. Once you click on it, you will be landing on the screen. So here you need to specify what is the type of waste that you are getting, what are the steps that are being involved, what are the steps red, yellow, blue, white. So whatever it is coming, you just enter it like this. For example, 5 bags red, 5 bags yellow, 5 bags blue, like that, or corresponding weight. Once you submit, your data will be visible on your history. So which means the data is successfully sent to the server. Here there is a provision made in such a way that you can able to see your particular details like phone number. And if you feel like English language is not convenient, you may start using other languages which are available. Same thing, once data is successfully entered from the screen, so you will be pointing out into the system using mobile app. Then the next part will start from generator. Generator has been already submitted. Now transporter has to come into the picture and start filling the data. In the sense, only thing he has to do is he has to accept the data. So for that, what he has to do is log in into the application, just accept the waste, just enter the name and everything, select hospitals from the drop down list available, then he can accept the waste. Once the waste is hospital for the corresponding hospital, the data will be automatically sent to the server. So which means hospital is entered, and while registering, hospital is already specified that I'm giving some X amount of waste to corresponding CPWT. In the background, this vehicle details is already tie-up and integrated in the system using admin credentials by CPCB. So in that case, whoever goes onto the field, all the trucks which are associated of the CPWTF can able to see the hospital which are registered against it. Why we are doing is like it is already mentioned that as per CPCB COVID protocol, each CPWTF has dedicatedly managed the trucks for handling the COVID. So now waste has collected by the trucks and it has been sent to the server, and now finally CPWTF will be there. What he has to do is he has to do login into the application, accept the waste by total number of trucks he has having. So for example, let's say this truck has been collected 10 hospital data. So 10 hospital data in a single row he will have it. For the moment he has assets, he will be having how many bags it has been carried, total number of it, how many trips it is done. So this is how mobile app works. So which means I'll summarize, the mobile apps will be working on 3 levels. Just a second. So the mobile app will works in the 3 ways. Generator will enter, transporter will cross verify and update any changes is required. Finally, CPWTF will accept, which means the data has been entered at 3 levels. So this is all done. Now almost everything has been done. Data came to the server. What next? The next step involves in the verification and approval process. In this verification and approval process, 2 people are mandatorily involved. That is one is CPWTF, second is the SPCB. Because at end of the every month, CPCB will do an internal inspection saying that how many SPCBs has been verified the data, how many CPWTF are daily entering the data. Likewise, they will carry out some things. For the ease of convenient, we have designed one web application where CPWTF and SPCB can come and they fill their information. Okay, so Only thing, already username password is there. They have to use this. The moment they land, you'll be getting login screen where they can see how many bags are there, how many breakups of each of the variant, and also total number of waste it is, how many trucks were there on the field, how many trips it has been done, how much of waste it is collected, how many bags are there. There is a real-time dashboard where you can see data which is being come from hospital, data which is being trucks are carrying, data which is being CPWS is accepting, amount of data which is urban local is valid entered, captive treatment facility how much is entered, all those things. Now this is the important section for both SPCV and CPWTF. So you will be getting this data automatically through the Maple. At the end of the day, you have to do it by using what do you call like approving a subject. What you have to do is, although the data is coming into the system, you have to cross verify once whether the data which is being sent by the system is correct or not. And also you have to specify out of 100 cases today, how much has been came from COVID hospital, how much non-COVID hospital, how much sent it for recirculation, all those things it has been done. Then same thing SPCV has to do, how much of waste it has been generated by a particular CPWT, they have to check whether the data is correct. The moment you approve, then only the data is correct. I'll give you a walkthrough of it. So this is how the approval has to be done, and this is very mandatory thing for approving, because most of the CPWTF in the Karnataka were not following this one. Because of this, you don't have it. So at least you should maintain minimum 22 approvals per month, which means 22 green cells should be available in your account to avoid compensations against you. Okay, else you will be under. I can see none of the people is being doing this. Anyways, so this is all. You can have light reps and the total number of hospitals that has registered. Hello? Hello?
Yes, Manoj.
Pooja, ಕೇಳಿಸ್ತಿದೆಯಾ?
ಕೇಳಿಸ್ತಾ ಇದೆ.
So this is how the mobile application works and web system. So is there anybody from the CPWTF side? Hello? Is there anyone from CPWTF?
They have joined actually.
Do you have any CPWTF in Gadag, Pooja?
It's Gulbarga.
Okay, Gulbarga. Okay. We'll wait if they join. I'll show them how to do the approval process.
Okay.
Someone Foundation, Kalburgi. This is the one.
I think they have left. Manoj, actually from Brindavana Foundation, they joined. I think they have left now.
Okay.
We'll try to make them join again.
Yeah. Meanwhile, I'll be. Let me know you can able to see my web page.
Yes. It's visible. Hello.
Yeah, if they're not, we can show it with Karnataka.
Okay. Actually, we tried calling them, but it's not reachable.
So I'll show you Karnataka thing. How, as an so, or they are not able to join, right?
Yes. And
So this is a screen when it comes. This is a
ಫೆಸಿಲಿಟಿ ಅವರು ಬೃಂದಾವನ ಫೌಂಡೇಶನ್ ಅವ್ರು ಜಾಯ್ನ್ ಆಗಿದ್ದೀರಲ್ವಾ? ಬೃಂದಾವನ ಫೌಂಡೇಶನ್ ಬಯೋಮೆಡಿಕಲ್ ಫೆಸಿಲಿಟಿ ಕಲಬುರ್ಗಿ.
Yes, sir. Present.
ಸರ್ ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಂಡು ಮಾತಾಡಿ.
Manoj, Akhilesh has joined from Common Biomedical Waste Facility.
Good afternoon, Akhilesh. So
Yes, sir.
ನೀವು ಈ ಅಪ್ಲಿಕೇಶನ್ ಯೂಸ್ ಮಾಡಿದ್ದು ದಿನ ಡೇಟಾ ಅಪ್ಲೋಡ್ ಮಾಡ್ತಿದ್ದೀರಾ?
Yes, sir. Previously ಮಾಡ್ತಾ ಇದ್ವಿ, ಈಗ ಮತ್ತೆ ಕಮ್ಮಿ ಆಗಿದೆ ಅಂತ ಮಾಡ್ತಾ ಇದ್ವಿ.
ನಿನ್ನೆ ಒಂದಿನ ಮಾಡಿ, ಯಾಕಂದ್ರೆ ಇವತ್ತು ಮೀಟಿಂಗ್ ಇದೆ ಅಂತ ಮಾಡಿದ್ದೀರಾ?
ಇಲ್ಲ, ಆಡಿಯೋ ಕರೆಕ್ಟ್ ಆಗಿ ಬರ್ತಾ ಇಲ್ಲ, ಕಟ್ ಆಗ್ತಾ ಇದೆ ಮಿಡಲ್ ಅಲ್ಲಿ.
ನೀವು ಡೈಲಿ ಅಪ್ಲೋಡ್ ಮಾಡ್ತೀರಾ? ಸೊ ಇಟ್ ಇಸ್ ಗುಡ್. ಏನಾದರೂ ಡೀಟೇಲ್ಸ್ ಇಲ್ಲಿದ್ರೆ ಯು ಸ್ಟಾರ್ಟ್ ಅಪ್ಲೋಡಿಂಗ್. ಓಕೆ, ಸೊ
ಓಕೆ.
ಇಲ್ಲಿ ಅಸಲು ಒಂದು ಕೂಡ ಎಂಟ್ರಿ ಇಲ್ವಾ? ಎಲ್ಲ ಒಂದು ಕೂಡ ಆಸೆ ಪ್ರಾಬ್ಲಮ್, ಎಲ್ಲ ಝೀರೋ ಇದೆ. ನಿಮ್ಮ ಯೂಸರ್ ಐಡಿ ಹೇಳಿ.
ಒನ್ ಸೆಕೆಂಡ್.
So I cannot, if even I query the data from last year as well, from November. Okay, there is no data point, right? Since you are not using the application. See, there is the data. So for November, in the one data point illo. See, this is an opportunity to you right now. If you want to really to do it, you do it. There is no restriction. Okay, so but ಈಗ CPCB ಒಂಚೂರು ಬಿಸಿ ಆಗಿದೆ, ಅದಕ್ಕೆ ಅವರು ಚೆಕ್ ಮಾಡ್ತಾ ಇಲ್ಲ. ಬಟ್ ಒನ್ ಡೇ ದೇ ವಿಲ್ ಶ್ಯೂರ್ಲಿ ಕ್ರಾಸ್ ಚೆಕ್ ವಿತ್ ಯು. 100% ಐ ಆಮ್ ಶೂರ್ ದೇ ವಿಲ್ ಕ್ರಾಸ್ ಚೆಕ್. ನೋಡು, ಅಸಲು ನವೆಂಬರ್ ನಲ್ಲಿ ಅಸಲು ನೀವು ಅಪ್ಲಿಕೇಶನ್ ಯೂಸ್ ಮಾಡಿಲ್ಲ. ವಾಟ್ ಇಸ್ ದ ಯೂಸರ್ ನೇಮ್ ಸರ್? ಹಲೋ ಹಲೋ,
you are audible.
ಅವರು ಇಲ್ವಾ? So even Karnataka, Karnataka is also not approved the data. So I would recommend please start approving the data. So see sir. So October linda ondu kuda illa. If anybody from the SPCB side, at least you make sure that you approve the data who is joined. So because only thing you have to do is select this one and just put an approve. ಒಂದ್ಸಲ ಅಪ್ರೂವ್ ಮಾಡಿದ್ರೆ ಕರೆಸ್ಪಾಂಡಿಂಗ್ಸ್ ಎಲ್ಲ ಗ್ರೀನ್ ಆಗುತ್ತೆ. ಈ ತರ ಜಸ್ಟ್ ಅಪ್ರೂವ್ ಮಾಡಿದ್ರೆ ದಟ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಸೆಲ್ ವಿಲ್ ಟರ್ನ್ ಇಂಟು ಗ್ರೀನ್ ಕಲರ್. ಸೊ ಅಟ್ ಲೀಸ್ಟ್ ಸ್ಟೇಟ್ ಬೋರ್ಡ್ ಇಂದ ಅನ್ನೋದ್ರೆ ವಿ ಶುಡ್ ಬಿ ಮೋರ್ ಕಾಮನ್. ಐ ಡಿಡ್ ಇಟ್ ಆನ್ October 31st, but whereas you have to do it the things for the rest of the dates as well. So, even though CPWTF or approve ಮಾಡಲಿದ್ರೆ that is still it is okay, but SPCB, I request SPCBs also to take a part of this one and please clear all the approvals which is being pending from. ಪೂಜಾ ಅವ್ರ ಹೆಂಗೆ ಅವರು ಯೂಸರ್ ನೇಮ್ ಶೇರ್ ಮಾಡ್ತಿದ್ದಾರೆ ಇಲ್ಲ ನಾನು ಸಿಸ್ಟಮ್ ಲಿಂದ ತಗೊಳ್ಳಲ್ಲ?
Manoj, actually I'll share your details with them and they will contact you to get more details.
Okay.
And
so this is the same thing, Pooja. Same thing they have to do. Okay. So same thing they have to select a particular cell and just click on approve. Nothing other than that. Okay.
okay,
So ask
might be
them
they are not
and,
getting.
they have not done the date of approval from since last 1st November onwards. So if it is the case, they'll be surely maybe in a day or a month. If CPCB cross-check, they will be caught.
Okay, Manoj, we will be providing all the details, necessary details if they approach us.
Okay.
So they will contact you.
Sure.
Okay, thank you, Manoj. Thank you for demonstrating COVID-19 biomedical waste management app.
Okay.
Thank you.
Thank you.
Sir, with the permission of all resource persons, can I take few questions in the chat box so that we can have a discussion? Dr. Ramkrishna Gaud sir, and Dr. Akshay sir, and Dr. Nasimha sir.
Pooja, I have one more meeting. Maybe one or two questions we can take at my end. I
Okay,
have
sir.
a meeting starting in the next 10 minutes.
Okay, sir. Okay, sir. Just
Totally,
2-3
if any one or two questions we can take.
Okay, sir. Sir, Jyoti Shivaji is asking, can we segregate expired drugs directly to the yellow liner bag?
Okay, that's a good question. ನಾನು ಹೇಳ್ದಂಗೆ and slide ಅಲ್ಲಿ ತೋರಿಸಿದ್ದೀನಿ. While all the waste in the yellow goes for scientific burning by incineration, pyrolysis, or any other technology that comes later on, basically at very high temperatures, at temperatures of more than 1000 degrees centigrade at least. So that is one. But pharmaceutical waste per se cannot go into the first yellow container. That is along with the cotton dressings, anatomical waste, pharmaceutical medicines, drugs hakokagodilla. Pharmaceutical waste should be treated as a separate entity. We should go into a separate yellow bag, yellow container, which is labeled as pharmaceutical waste. It cannot go into the yellow container which has cotton dressings, sanitary napkins, or anatomical waste. It should be contained separately.
Sir, next question. Is it necessary to autoclave the empty blood bags after infusion to the patients?
After
by
infusion
Devappa,
to the
sir.
patient, after infusion into the patient, the empty blood bag, can it be, should it be autoclaved? Please autoclave. Please
Yes,
autoclave. Even if there is 1 or 10 drops of blood, it still calls for autoclaving. Autoclave it.
Yes, sir.
I know our common sense tells that syringe ಮಾಡ್ತೀವಿ, ಇದೇ ಮಾಡ್ತೀವಿ, ಇದು ಯಾಕೆ ನಾವು autoclave ಮಾಡಬೇಕು ಅಂತ ನೀವು ಕ್ವಶನ್ ಕೇಳಬಹುದು. But let's stick to the guidelines in the true letter and spirit, especially when it comes to blood bags.
Sir.
So the empty blood bag ಆದ್ರೂ ಕೂಡ, for the sake of safety, just autoclave it and put it into the yellow bag.
Sir, a question from Dr. Guru Prasada. Sir, everything is going on discussion on disposal and management. Any suggestion regarding recycling and make it useful in another ways? Any other
I
way?
wish our common biomedical waste treatment facility friends were there on this session. Okay, to answer that question, yes, that is again a very good question. In fact, in today's session, I missed out, but normally I make it a point to mention one of the things in waste management is waste minimization. ಒಂದು ಎರಡನೇದು ಡಾಕ್ಟರ್ ನರಸಿಂಹ ಅವರು ಹೇಳಿದ್ರು, reduce, reuse, recycle ಅಂತ. These are the two cornerstones of waste management. ನಾವು ಎಷ್ಟೇ ಸೆಗ್ರಿಗೇಟ್ ಮಾಡಿ ಎಷ್ಟೇ ಒಳ್ಳೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಿದ್ರು ಕೂಡ ultimately the challenge is to see that the amount of waste that we generate should be minimized. Point one. Point two, whatever the waste that we generate, that needs to be incinerated, that needs to be recycled. And a good example for this is the hospital medical plastics that are nicely recycled now. That is one good potential waste. It is being recycled. There are certain other places where the waste shops are contained in hard containers. Adರಲ್ಲಿ liquid cement ಎಲ್ಲ ಹಾಕ್ಬಿಟ್ಟು those things are used for laying the roads and for filling up and for putting up the foundations in many places, but they are all experimentally. But plastic na kaddayavagi recycle ಆಗ್ತಾ ಇದೆ, and that's one good thing that is happening, and all that is happening because of our segregation practices at the healthcare settings.
Thank you, sir. Sir, shall I continue or?
But, my colleagues are already here. I can take one more question.
Okay, sir. Sir, another question by Devappa, sir. If Vacutainer not sent to the lab in some situations like extra blood sample, in which color code bag should we discard?
Okay, Vacutainers are plastics and plastic-like material. You should go into the red container only. And Davitu Vacutainers na kuda technically it contains blood. It also needs to be autoclaved. It should go into the red. It needs to be autoclaved. After autoclaving in the same red container, red bag, it should go for further management at CTF. And CTF further they will autoclave it again. They will shred it and send it for recycling.
Sir, is it necessary to preload the sodium hypochlorite solution in the sharp container?
That is only from a safety point of view. See, technically ಇವಾಗ ನಾವು needle na ನಾವು ಯೂಸ್ ಮಾಡಿ ಅದನ್ನ puncture proof container ಹಾಕಿದ್ರೆ needle is deemed to be infected. It is going to be staying in that container for the next let's say 4 or 5 weeks depending upon the size of the container and the amount of waste shops you generate. So if we strictly go by the rules, anything that is infected cannot stay in our hospitals for more than 48 hours. So from that point of view, it's a good practice to keep your waste shops preloaded with solution, hypochloric acid solution. ನಾನು ಹೇಳ್ದಂಗೆ in the hand of one person in one contact, you are achieving segregation, containment, disinfection, and disfigurement. 4 steps of waste management will be achieved only by one contact. So my strong suggestion is please preload your waste shop containers with hypochloric acid solution.
Thank you, sir.
Okay,
Sir,
Pooja, I am also there.
yes, sir. Yes,
Yeah,
sir.
yeah, sir. You can leave the session,
Akshay.
no problem. I'm
Yeah,
there.
Akshay,
Here.
our
I can take some
Department
of
of
the
Psychiatry
questions.
is here to meet me. Can I just dealing
Yes, yes.
with everybody's permission?
Yes, yes.
Yes, sir.
Okay.
Thank you, sir.
Thank you.
Please,
Thank
you
you
can
all
leave.
once
I'll
again.
take
Thank you
up
very
further.
much. Yeah, bye.
Yeah.
Sir, Akshay, sir,
Yes,
shall
Pooja,
I read
really.
it out?
Yes, 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 please.
Another
Go
question by Devappa, sir. To whom intimation should be given regarding needle stick injury or minor accidents?
Yeah, the ಎರಡು questions ಇದೆ. ಒಂದು, in which color code bag bangles need to be discarded?
Yes, sir.
It is blue, and ಅದನ್ನ ಸಪರೇಟ್ ಆಗಿ ನಾವು ಇದು ಮಾಡಬೇಕಾಗುತ್ತೆ. ಏನು ಶಾರ್ಪ್ಸ್, ಮೆಟಲ್ ಶಾರ್ಪ್ ಅಂಡ್ ಗ್ಲಾಸ್ ವೇರ್ಸ್ ಅದೆಲ್ಲ ಬ್ಲೂ ಕಲರ್ ಇದರಲ್ಲಿ ಹೋಗುತ್ತೆ. ಒಂದು. ಎರಡನೇದು, ಟು ಹೂಮ್ ಇಂಟಿಮೇಷನ್, ದೇರ್ ಶುಡ್ ಬಿ ನೀಡಲ್ ಸ್ಟಿಕ್ ಇಂಜುರಿ ರಿಜಿಸ್ಟರ್ ವಿಚ್ ನೀಡ್ಸ್ ಟು ಬಿ ಮೇಂಟೈನ್ಡ್ ಇನ್ ಆಲ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಅಂಡ್ ಹೆಲ್ತ್ ಸೆಂಟರ್ಸ್. ಸೊ ಒಂದ್ಸಲ ಈ ನೀಡಲ್ ಸ್ಟಿಕ್ ಇಂಜುರಿ ಆಯಿತು ಅಂತಂದ್ರೆ ಅದನ್ನ ಮೆಡಿಕಲ್ ಆಫೀಸರ್ ಆರ್ ಟು ದ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಟರ್ it should be reported, or to the biomedical waste management committee, core committee ಏನಿರುತ್ತೆ ಅವರಿಗೆ ರಿಪೋರ್ಟ್ ಮಾಡಿ post exposure prophylaxis ಅವಶ್ಯಕತೆ ಇದ್ರೆ, if it is a requirement, it should be given to all the people who get this particular needle stick injury. So yes, the administrator or the medical officer, whoever is the authority in that particular institution, or if there is a nodal officer, should be reported about the needle stick injury and post exposure prophylaxis na initiate ಮಾಡಬೇಕಾಗುತ್ತೆ. So there are guidelines for this. You can get this particular guidelines from ವೆಬ್ಸೈಟ್ ಗವರ್ಮೆಂಟ್ ಆಫ್ ಇಂಡಿಯಾ ಗೈಡ್ಲೈನ್ಸ್ ಇದೆ ಇದಕ್ಕೆ post exposure prophylaxis ಗೆ. From NACO also there are guidelines, so you can use these particular guidelines. ಬೇಕು ಅಂತಿತ್ತಂದ್ರೆ ನಮಗೆ ರಿಪ್ಲೈ ಮೇಲ್ ಹಾಕಿ, we will be able to send those guidelines also. Needle stick injury, how to manage.
Sir, we have question from Rajan Nagarkar. Biomedical waste segregation audit by direct observation. Biomedical waste segregation audit by CCTV camera. On-site inspection of biomedical waste segregation at common storage area. Is there any data available on auditing of biomedical waste management?
Yes, whatever Dr. Rajhans has already put up, all those methods can be used for auditing. Apart from third party audit, what I had already told, but data regarding auditing of biomedical waste management, I don't know whether there have been private agencies which have been put up which have put up this particular data in the public domain. But yes, as far as auditing of biomedical waste management is concerned, CPCB has brought out certain fact sheets as well as in their annual reports. They have brought about what is the compliance of the healthcare facilities with respect to the guidelines. So all those gaps which I was telling, and the indicators which were focused, they were all related to auditing of biomedical waste. So I'm not aware of whether there have been some studies in this particular regard.
Sir, another question by Dr. Sharna Priya. Biomedical waste should be disposed every 2 to 3 days. What is the protocol to be followed?
Madam, in this particular regard, yes, we can tell that it should be disposed in every 24 hours time, if not maximum up to 48 hours. So the healthcare facilities need to get in touch with the common biomedical waste treatment facility, and they need to have a MOU with CBWTFs for picking up the waste after due segregation at your hospital. If it is a private hospital, madam, if you are going for starting a private clinic or a hospital, then once you have your KPME registration, it is mandatory for you to have a tie-up with this particular biomedical waste treatment facility for the collection of healthcare waste. So Nima district health officer hatra, there will be the protocol which needs to be followed once the KPME registration is being done. KPME registration ಕೊಡೋದಿಲ್ಲ ನೀವು ಇಲ್ಲಿ ಎಲ್ಲಿವರೆಗೆ ನೀವು ಇದನ್ನ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಫೆಸಿಲಿಟಿನ ಎಸ್ಟಾಬ್ಲಿಷ್ ಮಾಡೋದಿಲ್ವೋ ಅಲ್ಲಿವರೆಗೆ ಅವರು KPME ಇದನ್ನ ಕೊಡೋದಿಲ್ಲ. ಸರ್, anyone from DHO's office? Any representative from DHO's office?
Good afternoon, sir.
Good afternoon. Good afternoon. Sir, ಇದ್ರ ಬಗ್ಗೆ ನೀವೇನು ಹೇಳ್ತೀರಾ?
ಸರ್, ಇದು ಹೌದು ಸರ್. ಆಸ್ ಪರ್ KPME ಏನಿದೆ ಸರ್, ಫಸ್ಟ್ ಅವರು ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅವ್ರ ಹತ್ರ ಸಿಸ್ಟಮ್ ಇನ್ ಪ್ಲೇಸ್ ಇದೆನಾ ಇಲ್ಲ ಅಂತ ಏನು ಇದಿದೆ ಸರ್, ಫೋಟೋಗ್ರಾಫ್ಸ್ ಪ್ಲಸ್ MOU ಮಾಡ್ಕೊಂಡ ನಂತರ ದೆನ್ ದೇ ಹ್ಯಾವ್ ಟು ಸಬ್ಮಿಟ್ ದಟ್ ಟು KSPCB ಸರ್. ಅವಾಗ ಒಂದು ಅಥರೈಸೇಷನ್ ಕೊಡ್ತಾರೆ ಸರ್. ನಾವ್ ಇಟ್ ಈಸ್ ಲೈಫ್ ಟೈಮ್ ಅಥರೈಸೇಷನ್. ಆ ಅಥರೈಸೇಷನ್ ನಮ್ಮ KPME ಪೋರ್ಟಲ್ ಅಲ್ಲಿ ಏನು ಚೆಕ್ ಲಿಸ್ಟ್ ಏನಿದೆ ಸರ್, ಇವೆಲ್ಲಾನು ಕೂಡ ಮ್ಯಾಂಡೇಟರಿ. ಅಗ್ರಿಮೆಂಟ್ ಅಥರೈಸೇಷನ್ ಎರಡು ಇದ್ರೆ ನಾವು ಅದನ್ನ ಲೈಸೆನ್ಸ್ ಇದನ್ನ ಮಾಡ್ತೀವಿ ಸರ್.
Correct. So that answers your question. And if it is government hospital, so this particular purview of establishing will come under the purview of the district health officer and his team. And sir, one more question, sir. How are the funds for establishing this yearly tie-ups or MOUs with the common biomedical waste treatment facility being mobilized? Sir, whether it is through Arogya Raksha Samitis or whether it is through the common budget?
Hello, am I audible, sir?
Yes, sir. Yes, sir. Heli, sir.
So ಇದು PIP ಅಲ್ಲಿ ನಾವು ಪ್ರಪೋಸ್ ಮಾಡಿರ್ತೀವಿ ಸರ್. The funds are released depending upon the total number of beds accordingly, sir. The state has taken a decision regarding the fixation of the prices. So again, when it comes to district level, sir, the district level health waste monitoring committee, so it differs from individual separate district to one district, sir. So some in our district, the state has quoted 7 rupees per bed, sir. But as per the agreement in our district, as per the direction of the district administration, so they are charging 6 rupees per bed per day, sir.
Okay. So ಈಗ beds ಇಲ್ಲದೆ ಇರೋ facilities ಆದ್ರೆ how is it being managed, sir? For example, if it is a PHU,
No, sir. Actually,
ಆ ತರದ್ ಯಾವ್ದಿಲ್ಲ.
ಆ ತರದ್ ಯಾವ್ದು ಇಲ್ಲ ಸರ್. ದೆನ್ ನೆಕ್ಸ್ಟ್ ಏನಿದೆ ಇವಾಗ ಕ್ಲಿನಿಕಲ್ ಇದೆಯಲ್ಲ ಸರ್, ಕ್ಲಿನಿಕ್ 600 ದೇ ಹ್ಯಾವ್ ಮೇಡ್ ಕಂಪಲ್ಸರಿ ಸರ್. ಲೈಕ್ ಆನ್ ಎನ್ ಎವರೇಜ್ ಪರ್ ಮಂತ್ 600 ಆ ರೀತಿ ಚಾರ್ಜ್ ಮಾಡ್ತಾರೆ. ಲ್ಯಾಬ್ ಆಲ್ಸೋ 600 ಲೈಕ್ ದಟ್. ಸೊ ರಿಮೈನಿಂಗ್ ಬೆಡೆಡ್ ಫೆಸಿಲಿಟೀಸ್ ಏನಿದೆ ಆಸ್ ಪರ್ ದ ಕೆಪಾಸಿಟಿ ಆಫ್ ದ ಬೆಡ್.
As per the bed.
Yes, sir.
Okay, fine. So I think that is clear as far as this particular question is concerned. Yes. Any other thing?
Yes, sir. We have another question by Devappa, sir. In General Waste Management Rules 2016, it is not mentioned regarding different color-coded bags and segregation, where we can get the information.
ಅಲ್ಲ, ಇದು ಜನರಲ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಂದ್ರೆ ನನಗೆ ಗೊತ್ತಾಗಿಲ್ಲ ವೆದರ್ ಇಟ್ ಇಸ್ ಸಾಲಿಡ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ರೂಲ್ಸ್ ಆರ್ ವೆದರ್ ಇಟ್ ಇಸ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ರೂಲ್ಸ್. If it is biomedical waste management rules of 2016, it is clearly mentioned about the color coded bags and general and segregation. Iga, if you are talking about the solid waste, then yes, there are solid waste management rules of also 2016 where there is also segregation which is required at source into wet waste and dry waste. So wet waste alli biodegradable waste, dry waste alli non biodegradable waste which can be recycled. ಸೊ ಇದು ಎರಡನ್ನ ಕ್ಲಿಯರ್ ಆಗಿ ಅವರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಕೆಲವೊಂದು ಮುನ್ಸಿಪಾಲಿಟೀಸ್ ಅಥವಾ ಕಾರ್ಪೊರೇಷನ್ಸ್ ದೇ ಆರ್ ಆಲ್ಸೋ ಡೂಯಿಂಗ್ ಅನ್ ಅಡಿಷನಲ್ ದಿಸ್ ಒನ್. ಈಗ ಜೈವಿಕ ತ್ಯಾಜ್ಯ ಆರ್ ಬಯೋಮೆಡಿಕಲ್ ವೇಸ್ಟ್ ಅಂತ ಹೇಳಿ, ಎಸ್ಪೆಷಲಿ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ಸ್ಯಾನಿಟರಿ ನ್ಯಾಪ್ಕಿನ್ಸ್ ಆರ್ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ದ ದಿಸ್ ಒನ್ ವಾಟ್ ಇಸ್ ದಟ್ ಡೈಪರ್ಸ್. ಸೊ ಇದನ್ನೆಲ್ಲ ಸಪರೇಟ್ ಆಗಿ ಇಟ್ಟು ಕೊಡಿ ಅಂತ ಹೇಳಿ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಸೊ ದಟ್ ಡಿಪೆಂಡ್ಸ್ ಆನ್ ಸರ್ಟನ್ ಕಾರ್ಪೊರೇಷನ್ಸ್ ಆರ್ ಮುನ್ಸಿಪಾಲಿಟೀಸ್ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು the solid waste management. But in as far as biomedical waste is concerned, there is clear cut guideline and it is being quoted in 2016. And I can see that biopsy gun easy blades stillet for used for intercostal drainage. So idella blue color binning hogutte.
Okay, sir. Thank you, sir. I think no more questions. I'm not finding.
Yes. Needle stick injury, though already there is this one. So we will share the management of needle stick injury guidelines as per the NACO, and it will be sent to the requested participants. So if you have any other resources bekadre empri email ge bariri, we will be able to send all these resources including the presentations whichever we have presented.
Okay, sir. Thank you, sir. Sir, with your permission, shall I end this training program?
Yes, definitely. Okay. Thanks a lot for the participation.
Thank you, sir.
Team Gulbarga, Kalburgi. Thanks a lot.
Thank you, sir. I would like to thank all our resource persons, Dr. Prithvish sir, Dr. Ramkrishna Gaud sir, Dr. Akshaya KM sir, and also Dr. Narsimha sir and Mr. Manoj Kumar, who have briefed about biomedical waste management and present scenario, what are all the problems and gaps we are facing in managing all this biomedical waste. And I would also like to thank DHQM of Kalburgi district and also staff from veterinary colleges and hospitals and common biomedical waste facility staff who have attended this training program and made it a grand success. Thank you everyone.
Thank you, Pooja and team. Thank you, participants.
Thank you, sir.
Thanks, sir. Thanks a lot for your valuable presentation.
PPP Delta PCV should never be kept on ice pack. ಈಗ ಆಲ್ಮೋಸ್ಟ್ ಇನ್ನ ಅಮೌಂಟ್ 20-25% ವ್ಯಾಕ್ಸಿನೇಟರ್ಸ್ ಈ ಲೆಕ್ಕಾಚಾರಗಳು ಗೊತ್ತಿದೆ.
ಮುಗಿತ್ ಸರ್ ಈಗ
ಫಾಲೋ ಮಾಡ್ತಾರೆ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡೋಣ. ಬಟ್ ಇನ್ನಾನು ನಮ್ಮ